like to call to order this meeting of the Altoona School Board. It's a special meeting this January 26th at 6:02 p.m. Could we stand and have the Pledge of Allegiance, please? And a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Could we have roll call, please?
Mr. Baker.
Here.
Mrs. Bream.
Here.
Mr. Francis. Mr. Huff.
Here.
Mr. Hoover.
Here.
Mrs. Irwin Adams. Mr. Johnston. Mr. Cruz.
Here.
Dr. Malloy.
Here.
Thank you. Not having an executive session tonight, and I would like to remind everyone to turn their microphone on so that they can hear you when you speak. Moving along to special presentations, we have Mark Taylor.
Good evening, everyone. Can you hear me okay?
Yes.
Yes.
Certainly realize you guys are into some major challenges with deciding what to do with school. Certainly I can't provide you a lot of guidance. I know you have to follow your DOE regulations. What I can do is give you a little bit of an update as to where we are and some information I've received just recently from PEMA and Department of Health. Our numbers are looking better. We're at lower case counts than we've been for a long, long time. Our positivity rate finally went under 10. And that's a trigger, I know, for some of the schools, but particularly for our nursing homes when it comes to testing and things. So that's very favorable. Probably the best metric that I like today is we've seen our lowest number of cases, COVID patients in the hospital than we have for many, many months. We were down to just 38 today, and it had been running well over 100. So it looks like we made it through what they were hoping was telling us was going to be a holiday surge. The people in Blair County apparently have been following the guidelines, and we haven't seen the surge that we were expecting. So that's good news. We can hope that that continues, trying to keep community spread down and all the other things that we've been doing so that it stays that way. We're hoping that these improved numbers doesn't build complacency where people just start going about their business, forgetting the masking, forgetting the social distancing, because we can backslide very, very quickly, as we've seen in other areas. There's also a new concern out there with this new viral strain, which there's a lot of unknowns, but it is believed to be more contagious, also more deadly. So we're keeping an eye on that, trying to see, if that grows or not. Only a few cases, so we're hoping that that doesn't materialize. We had a senior level management call with PEMA. Department of Health was on the call late yesterday afternoon. We were hoping to get a revised vaccination plan following the new version 5. However, we didn't get much of an update, to be quite honest with you. The version 5 entails moving the 65 and older and those with morbidity problems into that session. Adding, as you guys know, 3.5 million extra people into 1A, which certainly makes it a major challenge trying to get your teachers and other staff vaccinated into the 1B. I thought we were going to hear that there was a lot more vaccine on the way. We learned just the opposite. That even though they moved all those people into 1A, there's no extra vaccine currently in the pipeline to handle that. So the state right now is getting, I think, between 140, 143 doses. That gets spread out about 500 entities. 32% of that 143,000 is still going to CVS, who is doing the nursing homes. So that quickly gobbles up most of the available vaccine. We had hoped, and Tim's on the call with us here tonight, we have a pretty robust plan for vaccinating the 1B group, which would include police, fire, and of course your teachers being at the top of that priority list, as well as your bus drivers and all of you really associated with the school district. Your coaches, anybody is what we decided to put in that group. Your superintendent provided the list to us. It's on file. We're ready to start vaccinating 1B just as soon as they turn us on and tell us there's vaccine to do that. We learned from Director Padfield that right now they're hoping that the 65 and older group pays really close attention, gets in contact with their primary care physicians and their preferred pharmacy. That's where they'd like to see most of those people get vaccinated. They are looking at all the plans, including ours, as they start to open up first what they call community vaccination sites. In other words, not the gigantic things at the football stadiums and stuff that you see have been a real cluster on television. These would be more maybe 2, 3, 500 people a day. And we do have a good plan in place for doing that. The flow of vaccine isn't known. However, Director Padfield said they seem to be on a 2-week window. However, as we've seen, just about time we get through 2 weeks, there's another change either at the federal government or wherever that drives change, and we'll be looking at a version 6. So the good news is the numbers are better in Blair County than they have been for a long time. The bad news is the hopes of getting everybody vaccinated so we could start building some herd immunity looks to be a ways off. Your challenges, I'm sure, are based on trying to get as many students back in classroom as you can without causing spread within your school. And of course, my concern would be spread within the community. I've had similar meetings and discussions with some of the other districts. Some are being very successful in their return. And as you've seen with a couple, they've went a day or two and had to immediately revert back to virtual, at least for some time period. Yeah, made a special call tonight to my representative, Department of Health, before this call, asking if he felt there was going to be any way to pull the school districts out to be able to get vaccine, either as part of 1A or an accelerated 1B. He did not have any knowledge of that happening, although he understands why we would want to do that. But unfortunately, I can't tell you tonight that that's going to happen. You may have better information from DOE than I do on that. Certainly, I think it would be something that everybody should be pushing for, because the concern really, to me, doesn't go away until we get more people vaccinated. I think the risk to students is probably small, but you have a very, very large district there with a lot of people involved, a lot of, well, the whole group. I think you're close to 1,000 people. Some of the pharmacies, I know I talked to one in particular who was going to try to get you some vaccinations. He has not heard anything. And based on the call today, I'm not optimistic that he will. There's still hope, however. So I don't know what questions you might have for me beyond that. I've certainly been trying to support the schools the best that I can. I wish there was more that we could do. It just seems like there's so much out of our control. And on the call with the state and Department of Health, I can tell that they are very frustrated that they have not received the extra vaccine that was announced when Operation Warp Speed came out and made their claim that there was enough vaccine in the pipeline to get things moving. If anything, I think it's slowed. The hospitals are doing well. They've got a large percentage of their staff done. UPMC has opened up an outside clinic, starting to do more of the 1A people. But there is still a lot of 1A healthcare people that are a priority that have still not been vaccinated. All of the hospitals are starting to really help us out. We built a spreadsheet of 1A people, and we were up to, I think we still have about 1,000 people on that list on Friday. Today, that's down to 500 that I'm aware of. And of course, the hospitals are working on the people that they partner with to try to knock those out. So what we would hope that would happen sooner than later is that the hospitals get the 1A people done, which would allow them to start working on 1B, that the nursing homes get all the long-term care facilities, and guys, there is about 30 of them in Blair County. Once those are all done, that should free up more vaccination to go to work on the 1A and the 1B people. That is as much as I know right now. Like I say, this was a pretty high-level call yesterday. Director Padfield himself, who's now leading the vaccination plan for the state, was on. I trust Randy very much. I know that, his heart's in the right place, and that he definitely has the expertise to guide us. But until there is vaccine there, I don't see a lot of change. So somehow we've got to avoid complacency and still start making moves to get back to doing what we need to do. And I know that's certainly your biggest struggle. So I don't know if you have any questions that I didn't cover. Tim may have some remarks other than that. He and I have been working closely together on the vaccination plan and just a whole lot surrounding COVID in general, as do a whole lot of other people have stake in the game here. But I certainly understand what's in front of you, how important it is to get the kids back, how to do it safely without actually reverting back and causing a lot of COVID spread, COVID illness, whatever it might be to your students and staff, bus drivers, coaches, the like. So are there any questions?
I have a question. Do you know if they have the second doses for the people who have already received the first vaccine?
It's my understanding they have the second doses already. I don't know whether you want to say reserved, but they have access to get everybody their second dose.
Okay.
Mark,
Yes.
this is Chuck Prietel. Just quickly, Monday we receive a number, and that number represents, I'm assuming that number represents the weekend. When we get a number, that the end of the day Monday number.
Yeah, that includes we weren't getting numbers on Saturday. We are now, but we sometimes don't get Sunday. So that can often be a combined number for 2 days.
So judging by the drop in that number, because it was 45 on Monday, and I've seen that number upwards of 200-300. What's your opinion?
Right now, it's still going down. Today was one of our lowest days we've had.
Mark, this is Rick Hoover here. You touched on this. We're looking at the new strains, and I've been reading up on some of the literature on it. With the new strains, and we're tending to see that it's a lot easier transmitted and actually might be a little more deadly. Have you seen the recommendations for the double masking? And do you have any thoughts on that?
I have not followed up on it. I know it's a recommendation from Dr. Fauci that he believes that the double masking would help. I don't know that there's been any requirements or even recommendations for people to do that yet. And I believe that is in reference to the new strain being more viral, more contagious. But that's going to have to see how the science plays out.
And let me piggyback too. Going back, the numbers are trending down. That's a good thing. And I think if we go back and look at the numbers, I think going back to maybe October, we saw the numbers looking pretty promising. And that's when we attempted to bring the kids back. And we saw a spike after that. We had a heck of a time keeping our kids in school. I'm just wondering, and this is strictly your opinion, how do you feel that us bringing the kids back, did that have any effect on our numbers at all?
I believe most of what we've related we'll call it the Thanksgiving surge, was more related to large family gatherings, trips out of state, and things like that. It would be hard to pinpoint what impact the school had. I don't believe you had a lot of cases back then. So I think that surge was probably more a general community spread without being able to say it was related to the school. Certainly it would have been a contributor, but to what degree, I wouldn't have any way of knowing that.
And you are very clear. You said about not becoming complacent. So you are saying that regardless, we should be maintaining proper protocols of wearing masks and gatherings, and definitely doing the distancing and washing practices, correct? So masks are extremely important when in the public.
Absolutely. The guidance we got today, and if you saw the governor's press conference, there definitely not any let up into social distancing, the masking, and all the things that are out there. Even testing, the more of your people you can get tested, the better too, because that lets them know that they have the disease or the pandemic and that they can prevent the exposure by quarantining or whatever's necessary. That's something a lot of people still haven't got, just how important that testing is.
Thank you very much, sir.
Any other questions? I believe we're moving along to Tim Heilman.
Good evening. Thanks for the opportunity to speak. Just like to preface that, I have facts here, and Mark went over a lot of them. Any opinions would be my own. Moving forward, though, I'd just like to kind of relate some of the numbers that Mark talked about with what I brought to the board previously, and just to kind of give you an idea of how we're proceeding with the number of cases. Back in the middle of January 12th, I believe it was, I gave you numbers of 447 new cases per 100,000 per day, or excuse me, per 7 days, which is what your metric is for one of the metrics for the recommendations for determining instructional methods. And as of today, the number was 249.4. So it dropped nearly in half just since the last time I presented to the board. So our cases are really improving. And one of the metrics that you did meet was the positive test rate, which is down from 12.4 to 7.9. So that's good news. And that good news is coming out of people being more aware, people being adhering to some of the recommendations from the CDC and really the use of masks, which has been really touted as one of the biggest things that you can do. I would like to also say, before we go too much further, is that I'd just like to thank Mark for being on here tonight. Mark and I have worked closely and spent a lot of long days and hours planning and putting things together for vaccines and just planning for COVID-19. You can call Mark at 8 o'clock in the morning, and if you see his reports that come out, sometimes they don't come out to 8 o'clock at night. So he's working 12-hour days, and I just like to thank him for his service to our community and what he's done. He's been a great leader at the county level, and really should be commended for his service to our community. One of the other things I just like to mention, and I'll answer any questions you have maybe from the city standpoint, but Dr. Prietel and I had a conversation today, and we were throwing around some ideas about vaccinations for teachers. I did just recently, right before the call, got confirmation that we can vaccinate any of your staff that are veterans I got with the VA today, and they said that they can go ahead and vaccinate any of the school employees that are veterans, and they have the vaccine available. Their supply chains go through the federal level and are not connected to being distributed through the states. So they're accessible. They're very more accessible to the vaccine than what we have right now. So, Dr. Pretel, at some point, if we can maybe get that demographic together and find out how many veterans you have out of your 1,200 or so employees, we might be able to get them vaccinated right away, and it'll take some of the burden off later on.
We can probably do that tomorrow.
Outstanding.
I'm gonna have a number by noon.
And again, Mark pretty much said it all, and obviously him and I work together in this, so most of the information he gave you is exactly what I have. So, with that, pending any of your questions.
Yes, I have a question. I think you just said the positivity rate is down to 7.9. Is that correct?
Yes, that's correct.
Okay, we had different information, so I just wanted to make sure. Thank you.
Sure.
Hey, Tim, real quick, you mentioned about the veterans. That just pertained to educators, or does that go into bus drivers and janitors and others?
Yeah, I mean, anybody who's a veteran right now can go to the VA and get signed up and get a vaccine.
Tim, could you tell me?
They're still vaccinating within the same parameters as everybody else, but they have much more accessibility. And I talked to them today, and they mentioned that any of the teachers and educators could get the vaccine over there. So we'll have to follow and see exactly what happens with that. But if we get the names and the number of vaccines, we might be able to push that along a little bit quicker.
Tim, I was looking at the website. I thought that number was 9.7.
As of today, I pulled this report probably about I don't know. It was probably about 3 o'clock this afternoon, 4 o'clock this afternoon. It says the positive test rate 7.9.
Good. The praise you were giving to Mark, I want to give you the same praise. I thank you for coming in and doing this. I know you don't have to, and I know at times it can be a hardship. But one of the things I think is very important, do we have a current fatality rate in Blair County from COVID?
A fatality rate?
No. What our
Yeah,
current death numbers are.
Yeah, I don't have a mortality rate for this month yet.
I know between December and the last time we had a meeting, we had 100 and some deaths in that time period. I was just wondering if that had slowed down.
Yeah, absolutely, it did slow down. It doesn't make it any less painful for the deaths that we have had, obviously, but the number of deaths have gone down. As of this report that I pulled at 3 or 4 o'clock this afternoon, our ICU capacity is gone down also. At one point, I think back in early January, we were as high as 91% usage in the ICU capacity, and a lot of that isn't just because of COVID. It's because of normal ICU usage rates, and then we tack on top of that the cases of COVID that runs us closer to those resources that we talked about before. Something that we want to try to protect in the community, but that's even gone down almost 10% over the last week or so. So UPMC is starting to see a little bit of relief with that, but I can tell you, even the number of cases, they still have nurses and doctors and healthcare workers are definitely being tasked and really doing yeoman work in our community.
And once again, Mark touched on it, but obviously this is a big pet peeve of mine. You both are in a very important position to talk about ways to limit the spread of this. How important is it to you that we, even as our numbers drop, that we continue to have mask use, social distancing, hand washing, and all the procedures that have been laid out to us in order to stop this spread?
I mean, obviously that, since the one thing that has been a constant, there's been things change back and forth about the science, But I think everybody's been in lockstep that, you know, wearing a mask does reduce the amount of chance that you have of, you know, contracting the disease, getting the virus. And, you know, hand washing and that. I mean, these are all things that have been in place for years and years and years. I mean, you know, protecting yourself from colds and flus. You know, we've always talked about washing your hands, and, you know, as even the teachers can attest, you know, having the kids go and wash their hands throughout the day and making sure that they do that for just good general hygiene. And really, I don't think anybody's asking anybody to go really out of what's normal. The masks, of course, are difficult, and you know, it's difficult for kids to be in school all day with those masks on. With social distancing and with you know, those universal precautions in place, it does mitigate the risk. But can we mitigate it completely? No. I think that's where the vaccines come in. Are we going to vaccinate everybody? No. But the people that we do get vaccinated will help us get towards that herd immunity that we're looking for in the community, that can stop the spread of this and you know, narrow down the possibility of the high fatality rates.
Once again, I want to thank you for going over and above for us. I know that you've received some heat, and that's unwarranted. I appreciate every effort you are giving to us, and thank you for providing us with the information we need to make a decision. Thank you very much.
Thanks.
Go ahead.
I have a question. Biden and the CDC said the transmission in school is scant. Mental health and suicide is on the rise. They also said that we should hold off on indoor sports. What do you think about that?
I mean, the indoor sports and the and transmission of this virus is it's all about mitigating the risk. And, you know, when you're in close contact, and, you know, most of the sports, especially in the fall, I mean, you know, basketball and those things, I mean, you have contact and you're in close proximity. It's impossible to social distance while doing those sports. So can they be done safely? I think you can take a lot of steps to mitigate the risk. But I think that that the chances of spreading the virus is much greater than being able to mitigate it down to where it's not a problem. So you know, that's very difficult. It's a difficult thing to make a decision about. But as far as the schools go, same thing. If you're putting kids back into classrooms and you're not 6 feet apart and you're not able to wear masks, and there's times during the day when kids can't wear the mask. I mean, during lunchtime and things like that. And obviously kids need a break from the mask too sometimes. So those are all times that are, you know, you have the higher risk. So really the decision point is trying to mitigate the risk and being serious about that, and really looking to see where you can and can't do it, and making decisions based on that.
Hey, Tim, the POD, the point of distribution.
Mm-hmm.
Now, when you set that up, that will be based where?
Okay, so we have actually two planned in Blair County. One is in Altoona here at the VA hospital in the parking lot. Out front, we have tents and some things that we're going to set up, and we have heaters. You'll be able to drive through there. You know, basically fill out the paperwork, lower your window, and put your arm out the window, and they'll give you the vaccine. You pull forward, wait for about 15 minutes, and then be released once we make sure there's no issues with anaphylaxis or anything like that. You know, that pod was designed to handle all of our, you know, 1A going into 1B. And again, that's changed. We're on a fifth version of who's going to get vaccinated. So that's kind of really changed. But what we planned on doing is about 2,500 to 3,000 people. That would be our critical workforce. And that's where we're going to do that. Now, the convention center was going to be for the more for the general public. And that's going to be run by some other folks, but you know, my concern was the plot at the VA, and you know, we should be able to do 5,000 people there in 3 operational periods, 3 12-hour operational periods.
One more question that's escaping me right now. Well, it'll come back. Should have written it down. That's all right. It'll come back up. Oh, I know. We are looking at this point, we're not, as it sits, we're not going we are probably not going to see a significant supply of vaccine for at least 2 weeks. Is that correct?
Yeah, Mark had talked about his meeting with Director Padfield and the Department of Health. They are stating that they won't have any idea for 2 weeks, even when the next one will be available. So that's not saying it's going to be available in 2 weeks. That's saying they're not going to hear anything for 2 weeks, and there's a big difference.
Got it. Thank you.
Tim, one more question. I heard the one number I know, and the other one is the incidence rate. Is that, what is the incidence rate?
Do you mean
Where
like
are we at with that?
you mean like infection rate? That would be how many people, if you become positive, what the rate is that you would infect somebody else.
Right.
We were at a 1, which means every person who got COVID gave it to at least one other person, and that has dropped now to 0.83. So we're down below 1. So that number has gone down, which is another good indicator of community spread, that we're heading in the right direction. We sure hope that we can sustain it, because
But with that, are we still in the substantial rate with that number?
yeah, basically all that means is that our number of cases is going down.
Okay,
That's really all that means.
thank you.
Oh, yes, I got a question. Mr. Harmon, Ron Johnston here. There's an option of getting a flu shot at the VA out in the parking lot. Would it be accessible to have it in-house in the school district here, per se, the auditorium? Or is that not an option?
We had looked at that, and with the uncertainty of school being in, school being out, with not knowing what was going to happen there, and having the support staff that we would need, it just worked out that the VA had runs these kind of clinics often, so we tapped into that resource, and really, believe it or not, it's much less daunting to have people just stay in their car, especially when when the weather's bad, rather than having to park them, get them into a building, and then get them out of a building. It's much safer to do it that way. It mitigates a lot of the risk of all kinds of issues. So the fact that we were able to have a parking lot like that, and have the tents, and have the heaters, and then have the support staff right there to help, it just seemed like a win-win for everybody.
That's fine. Thank you.
Mm-hmm.
Any other questions? Thank you.
Thank you, Tim.
We'd like to move on to Dr. Zane Gates, please.
Thanks again, Tim.
Okay, well, it's the great work that Tim's doing, getting vaccine. First, because it's going to take an army. It's going to take Tim. It's going to take as many people as you can and many options as you can. First, from a vaccination standpoint, to get vaccines in arms. There was some good news today from Pfizer that their production is much greater than they thought it was going to be. So that's exciting. And the news I heard, again, is nobody knows anything from 2 weeks from now on when there's going to be vaccines. Soon our office will have some. A number of your people come to our office, so that will be big. And some of the hospitals, I spoke with one of the leaders of UPMC and the leader of NASN. So anybody you have employees that could possibly be in 1A or have pretty good pre-existing conditions, they will be able to go there. And Chuck sent us a great priority list, which makes it easier to get the people vaccinated that wants to get vaccinated. But as you guys make the decision, getting vaccine should be secondary. That's exciting to get people vaccinated, and that's ultimately going to be the goal. But I think as a group, you guys should just take a look at what the current literature says about the transmission of COVID in the schools, and really understand, because a couple big articles came out today. One notably from the Academy of Pediatrics. And this is just hot off the press. So it's, one of the most reputable papers on this. And they state, and I think you guys should read this, because again, I'm here just to give you information. You guys are going to have to make your decision, because it's not just just bringing the kids back. It's the logistics of that as well. So, but you need good data. And their conclusion, and I read it, I think it's important, on the large cohort study that they did, with the mitigation policies in place, such as masking, which we know, physical distance, and hand hygiene, it resulted in minimal clusters of SARS infections and low rates of transmission in schools, and did not cause a larger community infection burden. Our data indicates that schools can reopen safely if they develop and adhere to specific, COVID-19 practice. I think that's very important, because basically the question isn't really the transmissions in the schools isn't the biggest problem. The transmission is in the community. That's the problem, and that's the data that really matters. What the transmission rate, below 8, it gives moderate risk in the community. Below 5 is optimal. Vaccines should be a secondary. The primary thing, whether kids go back to school or not, is can you do it safe? What the data says, what is safe and not safe, and try hard not to use opinion, because opinion is very difficult in this, because the science has been bad for a long time, not because of the science. It's just you need a lot of time to accumulate a lot of data to make any recommendations, and that's the recommendation. But as for, again, back to the vaccines, I think as in the next 2 to 3 weeks, things with vaccines going to get better. I think Tim and his group should be very successful in getting a bunch. The Eli Lilly one shot will be out and approved by the end of February. So it's only a 1-dose vaccination. So that's another thing that moves in the favor. And we think we can go after the 1A people and the list to start to get people vaccinated. So I've given you a couple papers in there that talk about it. And I think that's important. That's the recommendation that you have to really weigh heavily when you're making decisions on how to bring your kids back.
The study you referred to, is that K to 12? Was that K to 12 study or?
Yeah, it's K to 12. But the bigger thing, all the current and post literature, the Europeans did a pretty good study, and so did the Japanese. And at the elementary level, your staff, you're not really worried about the kids. They found they don't transmit it as much, and that the risk of your staff at that level is the same risk of them going to Walmart. It might be worse in Walmart because in schools there'll be much stringent mask wearing by staff. So in the younger kids, the data is super duper strong. But from this pediatric journal, this is hot off the press. So this is the latest study. I gave you the conclusion. If anybody wants the entire paper, I can make that available for you to read.
With a difference though between going to Walmart and being a teacher in a classroom, that a teacher's with a group of children for a length of time. In the elementary, it's 6 hours. In the secondary, each class period, they get a new group of students. When you go to Walmart, you're in and out in 10 minutes or so, and you don't mingle with people. In school, the other thing is you talked about following the guidelines, social distancing. One of the issues with bringing all the children back to school at the same time in Altoona is the number of students we have. And it creates a situation where you can't really social distance then in classrooms, even in a hybrid model with some of our, there's some situations in secondary, like cafeterias and hallways, when they're changing classes, when it's tough to social distance. So I think if we could find solutions to those issues, it would make it much safer for staff and students.
But what should make you feel a little more comfortable is what is actually happening in what they studied. This study was a total of 1.2 million students, and they had a case rate of 0.5 per thousand for a 2-week period, which is a student infection rate of 0.52%. A total of 381,000 staff had a case rate of 11 per 100,000 in a 2-week period, and for a staff infection rate of 1.15%. The community rate at that time in Blair County was 14.23%. That's when we were humming. And these are the numbers that the infection rates were. So this is just the data. This doesn't, like I said, I'm here just to give you data. You guys got to make a decision on the logistics, because it's not as, it's not just simple like, hey, they go back to school. There may be a hybrid, there may be those kinds of things, or maybe full, but it's all, the data says that, that the risk is no more than going to Walmart for the elementary kids. And you may,
Zane, it's Rick Hoover. I've got a question.
Rick.
Yeah. I'm very focused on the vaccine. Let me ask you this question. Someone gets a vaccine. How long does it take the first, let's say the first shot? How long does it take to build up immunity from that first shot?
2 weeks. You got about, some say 2 weeks to 10 days. And you got about 50 to 60%, depending on your own response. Then the second one, you got 2 weeks after you get the second one, and you're having 97% response rates.
Okay. So hearing those numbers and understanding that, that makes sense to me. Then I guess I'm trying to wrap my non-educated brain around this. What sense would it make to give somebody a shot and then put them back in the classroom before they build up any immunity?
That's why I said vaccines shouldn't be the tell sign of whether you bring the kids back safely. Because really, let's say we get the vaccine in 3 weeks. Tim and those guys and all of us work hard, we get in 3 weeks. You still have a number of time before the teachers are and the staff are completely protected. They'll get some protection after 2 weeks, but not 100% protection. So, but the good news about the vaccine in general is it prevents hospitalization and death. So, that's the most important part. But if you depend solely on the vaccination in making your decision, it makes it difficult, because how many people, it's important that we work like our tail off to get people vaccinated, but what's the number? I mean, nobody has data that says, okay, if you get 100 people vaccinated, this many people safe. If you get 500 people vaccinated, this many people are safe. If you get 1,000 people vaccinated, this many people are safe. So that's a very tough decision for the board to make, to base it just on vaccinations. It should be everything.
Zane, don't get me wrong. Do not get me wrong. I look at the vaccinations as a long-term solution. That's we're building towards herd immunity. But my concern is this, and you were probably a witness to this. We tried this a couple months ago, and even following all the recommendations that we were given that you just told us that we should gravitate towards and focus on, we failed miserably as a district, horribly, to the point that we could no longer even staff to educate kids. And I'm saying, I think it's a combination of the two. That's what I think. And I think if we're saying, hey, don't count on the vaccine, I'm going to count on the vaccine for our employees, because I want them as safe as possible when they're doing their jobs. So I think it's a combination of the two, but I certainly wouldn't want to send anyone back not even having 50% immunity. That doesn't make sense to me, but that's just me. Other people might have opinions.
Sure. And hey, it's not an easy question. Just know that the board, whatever decision you make, we have the full support of us to provide you essentially have your own testing center.
And I believe, Zane, the Department of Health, I believe they are recommending vaccination before going back to school. But that's the Department of Health.
Sure. Like I said, I'm here to give data, not to make recommendations, because I'm, not on the board. That's for the board to make recommendations. But what I can say, that testing's a big, important part, quick testing. And we at Empower 3 are committed to make sure that any of the members of the school district at any time through this process that need testing, we will be glad to test and have quick turnaround results. So just when you're formulating your decision, just know that you have that in your back pocket, your own testing center.
And one more thing, Zane, I know I'm kind of stepping over here, but both Mark and Tim are good men, but they are not physicians. Could you please tell us how important it is for us to be masking in public places and how important it is to distance? You are a physician. I'd like your opinion on that.
Oh, absolutely. It most definitely cuts down not only on cases, but how sick people actually get.
So you would recommend it in any environment, like let's say in the boardroom, if people are in the boardroom in a cluster, they should probably be wearing masks.
Yep, just like everybody else here.
Thank you, doctor.
Zane?
Yes.
Quick question. You're saying the Lilly vaccine isn't looking at being FDA approved till the end of February? Is it that
Yeah.
far?
Yeah, it's that far. That's what I've been hearing.
Wow.
It's a one shot.
I know that, but it's just, everything is timing at this point.
Yeah, I know. But we'll know more about that.
Zane, your article, you're saying that's covering K to 12, or is it just ages 6 to 14? That's what I'm trying to be
The
clear on.
article says K through 12. But I'm from the literature I've read all in the past, the elementary schools and to age 14, they saw that group did not transmit the disease significantly.
Okay, because age 14 would cover our junior high school too.
Yeah, that's what the literature says.
Okay, thank you.
I have a question. It isn't for Zane, but when we shut down in November, was it due to the COVID numbers or because Tom Wolf shut us down?
It was due to our numbers, the community surge, and just we were having problems staffing at that point, and also the fact that the community surge was accelerating greatly. So it was those two pieces. Governor Wolf did his move approximately a week later, where he shut everything down from December through to January 4th.
Superintendent, I clearly remember we didn't have the resources anymore. We had to shut down, correct?
It was primarily a matter of staff and of bus drivers. We had 14 bus drivers coming in from Philadelphia to make sure we had enough guys to drive the bus.
And we were having a hard time getting substitutes and so forth, correct?
Yes, there were problems across the board. Some of those problems aren't going to go away. But the thing is, at this point, I think we have to have a serious conversation about how we're going to get kids back, because I think that's a priority for everyone.
And I applaud the board. These I know, Rick, you're applauding Tim and Mr. Murphy. The board, you guys, take my hat off to you. You guys have had a tough run, and I hope you understand that this isn't an easy decision. So I think you ought to be commended.
Thank you, Zane.
Thank you. Zane, is the testing for positive cases more readily available now than it was back in October, November?
What do you mean, just testing? Yes, for the school district, we will make a commitment that anybody who wants a test can have a test that same day. Dr. Prietal have a great relationship now with our lab director. Anybody that wants to test, we test them at 10 and 2 o'clock and have results back in a half hour to an hour.
Zane and Empower 3 have been great about this. They've made sure that all of our people have been taken care of.
Well, I think that's a plus because back in the fall, we were having to wait days to find out if teachers were positive or not, and they were quarantining during that time. So we wouldn't have to have that wait period now.
We still have to wait through an incubation time frame, 5 to 7 days after an exposure. But the problem in the fall was, except for Zane, and there were so many people needing to be tested, that it was overwhelming because I was sending people that had to be tested to Zane. I believe I even sent your husband to Zane because just to get him back into the school. But the thing is, we don't have right now, because the pacing has improved and because the other options, it has gotten a lot better. Zane's time frame is still the best of anybody's as far as getting us answers. I believe I called this morning, got a test set up for 10 o'clock for somebody. They called me with their answer at 10:30. I mean, you couldn't beat that for turnaround.
Can I ask a question on that? We just heard about the testing. That's great. Congratulations, Zane. Does that encompass all of our employees, or does that only encompass the people that are, encompass the power plan? Does that, if you're a teacher outside of your network, can they come over and have it done? And is that covered by our district?
Yeah.
We're covering his expense.
So if you're not on Zane's plan, you can still go over there and get tested.
Correct, but you have to schedule it. They go through me.
Oh, good. I didn't know that. Thank you for doing that.
We've scheduled. President of the ASME had an exposure and needed to be tested. We got him in. We're getting everybody in. SEAs, teachers, custodians, secretaries. We've been working to get everybody, if they needed to get tested. The issue is you still have to wait a certain period of time, because if I have an exposure today, testing me tomorrow has not been enough time for me to give you a positive test. Yep. Wait 5 days or till I show some kind of symptom, then the test is going to be very straightforward. It's going to give you the true answer.
Yes. And the nice thing about it is what we do is people who are our members, there's no cost to the school district. You already paid for it. The only people that we charge are the people who chose not to pick our plan. And believe me, we're doing it basically what it would cost us to do it.
What is that cost?
It's $50, $42.
Okay.
Yeah,
that's good to know, because
lower than everyone else.
Yeah, there's some people out there who certainly would take advantage of that. They just need to know what it costs. That's good. Thanks. And thank you for doing that, Zane. That's awesome.
And we're trying to do, me, Tim, and this team, we're trying to do what we can.
Okay.
Any other questions? Well, thank you, Dr. Gates, for coming and presenting to us this evening.
Good luck, guys. Godspeed with you. Good luck.
Just a point.
Thanks, Zane.
Just a point for Chuck. Chuck, we just put that out in a public meeting. Could you please put that in writing tomorrow and send that out to all employees, that they could go to Empower and get testing if they need a test, just so they know that that's available?
They have to schedule through me. Okay?
I'm saying, could you put out an email or something to the staff knowing telling them that's available?
I can let people know it's available, but at the same time, it's one of those things where they're also going to MedFirst and other places too.
No. That's what I'm saying to you, sir. I'm saying we just found out by Zane that's available to people. It's a quick turnaround. I'm saying let every employee know that's available to them. They can go right over to Empower and get it done.
It's not quite that simple, but I'll let people know. Because Zane has a finite number of tests. Okay, and I don't want to flood him either, but at the same time, yes.
Okay, thank you.
Okay.
Moving along to discussion.
I have two things I want to throw in. Piggybacking off something Rick said, he mentioned the Department of Health had issued guidance about immunizations That is inaccurate. On January 7th, the Department of Health and PDE issued joint guidance that basically said they felt it was safe for elementaries to go back hybrid. There was no mention of vaccination in that release. They also did push that to possibly ages 10 to 14, which could have middle school implications. So just so you know, that is the guidance. Again, I work for an intermediate unit, so we do this all the time. So that I want to clear that up. The other thing this evening, as I was out running an errand, I had the radio on. The president did have a press conference this afternoon, and the feds are going to issue a 16% increase in vaccination distribution within 2 weeks. So there is at least some positive news, and they ordered 200 million additional doses, but those will not be in until the summer. So that's the most recent thing, and those are all available online if you search for the news.
Thank you. Now we're going to move on to discussion and development of revised reopening plan.
Okay. We've sent you documents, we've sent you information. Most of what you heard today, we heard today. A lot of what we gave you is obsolete. The way we see it, there's two factors. There's community spread and the level of infectivity, what they call that, the positivity rate. And there's the vaccine. What we're seeing with the vaccine, in early January, we're thinking, if we have the vaccine in a couple of weeks, we get everybody vaccinated. Now we're realizing that the vaccine is not going to be available probably, if we're lucky. I mean, this week, next week, if we're lucky, sometime the week of 2/16, if we're lucky. As Zane pointed out, 14 or 10 to 14 days before it really gets to the point where you have the maximum level of immunity from the first shot of the vaccine. When we first put this together, we were like, oh, we want an absolute day that no matter what, we would be hybrid on March 1st. And no matter what, we would have everybody back on the 14th of April. We had come up with a plan. If there was a vaccine, and let's say that we were vaccinating this week, then we would recommend bringing the kids back on the 8th. The thing is, we now know that the vaccine is probably not going to be available until at the best the week of the 16th, which means we're already to March 1. The question is, the community spread is falling, and it's falling extremely fast. We were at 700-800 cases a week prior to Christmas. Coming out of Christmas, we were 350 to 400. Last week we were 250. This week we are a half to a third of what we were last week. Last week our daily infection rate was 50 to 60 a day, right? We are now, Saturday, Sunday was 45 or 47. Today was 24 for a day. So we're to the point right now where we're really close. Depending on what happens over the next 4 or 5 days, we could actually be in the moderate range for this week. And that will be the first time in the moderate range since mid-October. Am I correct with that? Probably. Beginning of October. Factors that we know of. People getting sick at work, bringing it home to their spouses or their families, infecting the household, and in turn, by the time we catch it, those people who are teachers, et cetera, who work for us, or custodians, et cetera, then bring them to work. The other factor is kids coming home from college. In the fall, it was awful. Kid comes home for a weekend. Has a great weekend with mom and dad, goes back to school on Monday, you find them positive. Meanwhile, mom and dad are now quarantined, and chances are mom and dad end up with COVID. The kids are not going back. They haven't gone back to college till this week. I believe school started either this week or next week for Penn State. on campus. All right. I know my son, his school isn't starting until next week. Classes I'm teaching are starting this week. So I don't know if we're going to see this huge surge that we saw. That said, we've been planning on how do we bring the kids back in a hybrid mode. So at least we have half the number of kids, and we can at least get them every other day in the building. The question is, what day do we want to start that? How do we want to start it that way? I do not recommend bringing all the kids back at once. I know that it's easier to be 100% virtual. When we talked to the staff yesterday, now that they're in the swing of things with that, it was easier for them to be 100% one way or 100% the other way, meaning in school. And the hybrid is more work for them just because kids are bouncing back and forth. As administration, I think any of the administrative room would agree that we don't feel comfortable just bringing everybody in lock, stock, and barrel all at once. So if we went to we would recommend going to a hybrid for a period of time, probably 4 weeks, and then going to everybody back full. And maybe we can use the vaccine as a measure from that standpoint, because the vaccine, well, a month, let's just say we brought everybody back on the 1st. Well, now we have a month for the vaccine to catch up. But as it sits right now, we're not going to see anything in the vaccine for projection until the 16th. That said, I'm open to suggestions from the floor.
Are we prepared to bring everyone back on the 1st? Buses, that sort of thing, transportation? Can we make that happen?
There was an order last week that we had to be prepared just in case the board said that was going to happen.
Okay.
Right.
It's wonderful news.
I mean, for consideration, the things that we've looked at, and they're kind of highlighted on the front page of the information we provided. Obviously, our goal of the district is to get all of our students back, but do so in a way that is safe, where we can maintain social distancing. Masking is not an issue. I mean, masking is something that we've had in place the entire year in a face-to-face setting. We will continue with that, and we've had success with that when we've had students in. The vaccination numbers, obviously, we'd prefer to have the opportunity for parents or for our teachers and staff to have the opportunity to become vaccinated, because that can only improve the situation as we look at it, in terms of community transmission. As we talked with staff yesterday, those numbers are extremely encouraging. When you look at just from last week to this week, and the numbers we have ended last Thursday, the dashboard's only updated on Monday for the previous week. That's why our data is a little bit different than you had heard tonight from the experts. They can get daily numbers. We're getting a snapshot once a week. We are currently in the moderate mode at 9.7. I think Tim had said 7.9 as of today. But looking at our overall numbers of community transmission, those have dropped per 100,000 at the 240 range. So that's more than 100 of a drop from the previous week. So if that trend continues, community transmission could be to a point where we would be at or near 100. And at that point, the quicker we get to that number, we are looking at that as a benchmark to offer full in-return learning to all of our students. So if we continue the trend and we continue to move in that direction, obviously we can get there quicker than better. But we are equipped and ready to move to a hybrid model if that's what the board decides to vote on this evening. That being said, the information that we provided you was just the factors that we look at when considering these things based on, I think Mike had alluded to Dr. Levine's DOE's recommendation. You have a copy of that. That's the actual press release of what their recommendations were. In addition to that, we provided you with the attestation information that the Department of Ed is requiring us to adhere to when we do return to any kind of in-face learning. There are provisions that we have to abide by, including 6 feet of social distancing, which hybrid model will allow us to do, along with masking and all of the things that we're doing with personal hygiene and making sure that we have a safe environment for students, that we're doing our cleaning on a regular schedule. Now, all that being said, there are provisions, and that's the other packet, that in the event that we do have cases, based on the size of our schools, we do have to adhere to closure recommendations based on the Department of Ed, Department of Health's recommendations. And that's what local districts have seen when they've gone back. Their numbers are so low that if they get 2 cases, they have a forced closure for a period of time to where they can get their cleaning done, their deep cleaning done, and look at other provisions to get kids back safely. So we have all of those plans are in place. So in terms of, getting students back into school, getting staff back into school, that is something that we have constantly been planning for and having operations ready so that in the event that is a direction that we're going to move, that we are capable and ready to do so in a safe way. So that being said, our goals, this was a starting point for conversation. Kind of leaving it open-ended at times can be a little bit difficult. So just really having kind of a basis to work from. I know we had done this with our staff representation yesterday to get their feelings and get their opinions, challenges as to what that would be. As Dr. Prietel alluded to, some of the virtual challenges with elementary is that the way that we are doing the virtual piece or the non-live instructional days are being planned and delivered by another grade level staff member. And there was some lack of continuity in seeing students every day, whether it be in a face-to-face or a virtual model. That really doesn't exist in secondary because of the way that we're doing things in junior high and high school with live streaming by students in those classes. So, we had talked to the staff yesterday and looking at what are some options that we can give them that can increase that level of continuity with their students. Even though by and large, I believe that we've been very successful in delivering the program that we've delivered over the past couple of months. There are definitely challenges. There's challenges for our students. There's challenges for our families. But that being said, I know our staff has done an amazing job at doing everything we can do, including providing individualized support and going above and beyond in their daily responsibilities to help kids be successful. So that being said, I think we can kind of just generally have open discussion in terms of where the board feels as far as.
I want to just add one thing, just so everybody understands. When we designed the virtual in the elementary school, we did it based on staff recommendations. And there was a certain level of apprehension about doing the streaming videos. And so we made it so they didn't have to do the streaming videos. Well, now that they've been through the mix, they're like,
No one can hear you online, Chuck.
sorry. How about now?
Perfect.
When we set up the elementary school, we followed the staff recommendations because there was a concern about doing the streaming. But now that they've been through the virtual and they're much more comfortable with the platforms, they don't have the issues with streaming to the kids who are at home that they had back in October, November. So that's a good thing from a developmental standpoint, as we have continued to push out professional development and get everybody up to speed. That we've seen a very strong showing from all of our faculty in making this work.
The other piece of this as well is that, we want to maintain the options that we've made available for our families throughout this process, where we will continue to have a virtual option for students. That would be your day-to-day daily instruction delivered through the computer. Also, we have our cyber academies, which are available for any student to apply to those and then have that face-to-face model, whether it be hybrid or full return. At that point, we're providing every option available to students at this point, and we'll continue to do so for the remainder of this school year.
I think that's a very important point to make, because I know I've had some letters from parents that say they don't want their students going back and forth, being in school, and then it has to shut down and then they're back on virtual. I want the parents to understand that is their choice, how their student is educated. If we do the hybrid method, they will have access to that. They would have access to cyber, or if they like the virtual, they can continue that. No one's telling them that they can't. So I think that's an excellent thing, and it's up to the parents. I just have one question. Do we know how many teachers or staff have been vaccinated, if any?
All of our nurses, all of our police officers are done.
Okay.
As far as the staff, I know. I need a boom stand, man. I just don't got one. All of our nurses, all of our police officers are in 1A and they have been vaccinated. Anyone else who's been vaccinated is a 1A person who went through their individual physician. To be honest with you, the problem is availability. Like Thompson has it and he's been taking care of different people, but he hasn't called us because he hasn't any spares. But we did get a call from Thompson the other day when he wanted to do our nurses. The nurses had already been done, and they said, well, then can you send us 17 people, because they had the bottles open.
Right.
And if that was the case, did our special pops people get vaccinated? It didn't happen. Okay, all right. Well, we sent him 19 people on a list. That was the first request we got. So from that standpoint, I'm not going to place blame. It's just all of our nurses have gone to Encompass South and gotten it done. And so it was a matter of timing.
But if there's 17 vaccines available.
I'm sure, I can guarantee you that Bill Thompson did not waste those vaccines. It was just one of those things where he probably went to the next group on his list. Right.
He has a call list.
Right.
And I'm sure he contacted them, but we could have had 17 special ed people.
And we tried, but the thing is, it's timing and a couple other things that fell into place.
Well, that's important that when it's available, they're ready to go and get it, because there is a time factor there. I mean, it's not anyone's trying to be nasty, but that stuff will go bad and then it has to be thrown away.
We've communicated with our entire staff that they need to be ready on a moment's notice.
Right.
To be able to have asynchronous lessons if they're instructors, or they need to have arrangements that when their wave is called,
Right.
that wave it goes in that time frame, because it's really a 24-hour period where it's viable. So we have that system in place. We have them broken into call list categories, so that when we are made aware, hey, we have 200 vaccines available, we're notifying that plus to make sure that we're able to get that number of people vaccinated in the amount of time that it's available.
And we sent a list to Thompson, and the thing is, the providers do not want to be making decisions. They want a list and they just want to go through that list. We didn't know that going in. From here on in, we're going to make those decisions. If they say they have 10, we're going to send them 10. If they say they have 5, we're going to send them 5. And some people are going to hit the lottery and get sooner than others, but that's just how we're going to do it. That was one of those things where I was off in a building. I see in my email that somebody called from Thompson's. I got back here. We got it moving as fast as we could. But again, now that we know how they want it, we're going to make sure that we fit it into their parameters.
Right, because every 17 we get done, we get closer to getting our group done.
Well, right, but the thing is, the biggest issue is there are not, at this point in time, we do not have vaccines. No one has vaccines to deliver them. That's the issue at this point.
But you may have had people get them because they have underlying health conditions that are their first.
We're hoping, but we have a list, which I provided to another pharmacy when they asked for it. But again, when you hand somebody a list of 230 some people, well, that's a major piece of vaccines that they would need to provide.
We're working on a system for once they are vaccinated, that we are updating our list to indicate that they have done vaccine 1 or they've done vaccine 2, whatever. We're going to use a highlighted system on our spreadsheets that'll be our indicator as to which employees that wish to be vaccinated have been vaccinated.
Right.
Yeah, we need to take advantage of all
absolutely.
of those vaccines.
Well, absolutely.
And I think it's a plus too if Mr. Heilman can get us help from the VA for veterans, because I know that's a chunk of people or our employees.
But you understand, the first we were aware of that was today.
No,
when he mentioned it.
I understand that, but I'm just saying the more people we get vaccinated, the better.
Well, right, and which is exactly how we're approaching it. The thing you have to understand is everybody involved in this process is trying to do everything they can to get it to fly as fast as they can. But the thing is, it's brand new to everybody, because when they did H1N1, I believe, if I'm remembering correctly, or another vaccine that they did. Was it, I don't know what it was, but they literally brought people into the gym and they were running an express line.
We vaccinated in-house. We were able, our nurses did the H1N1.
Right. The problem is most of the facilities want us to do that again, but they have to have vaccine in order for us to do that. And right now, it's coming in dribbles and drips.
So when they updated 1A last week, we had to get something out to all of our employees. Do you qualify under 1A? Because you now, with the new provisions, you now qualify into that accelerated group. So we updated that on Friday, and we have quite a substantial list of people that qualify under 1A. So they are that wave one that we had indicated out. And then obviously the goal is to get everyone done as quickly as possible, but we have to have a system in place in order to do so. So there has to be a way to kind of tier that out, and we already have that built in.
And now we're at the point where we just know that if they say they got 10, we're just gonna go to a list and we're gonna pull 10.
Well, here's part of the problem I see, and this even included talking to Zane and both our experts. If you can't guarantee the second shot, what does it matter?
The second shot, it's a 4-week window, but it doesn't have to happen in exactly 28 days. So there is a cushion. The other thing is getting the first vaccination at least gets them started. So from that standpoint, I'm going to worry about the second vaccine a month from now, and hopefully the supply chain is going to be much more robust when we get to that point.
I think the hope is that we have a couple things going on at the same time. One, our community transmission numbers are dropping, and at the same time, we're increasing our vaccination availability and the rate that we are getting employees vaccinated and developing immunity. So as that's happening, we're hoping that those two things combined with the mitigation factors that we're doing within our buildings in terms of social distancing will positively impact, all of this moving forward. Now, that being said, as we indicated, this is pending no spikes. This is pending, no sharp uptick in cases that we can't predict. There's nothing indicating right now or predicting that moving forward. So that being said, we're hoping that everything is trending in the right direction for students to get back into school as quickly and as completely as possible.
Is there a way we can get on the list with perhaps the VA or the Elton Hospital and say, hey, if you have any leftovers?
We are. I talked to Mike Corso myself.
Okay, thank you. Because as of yesterday at 1 o'clock, the VA had 3 extra and a family member scooted over. There was a timetable there.
Right, because they have to use it within so long after they tap into the bottle. I want to say I want to say it has to be used in an hour. I'm not sure.
What was our final number of employees that said they would get the vaccination?
Over 800. 800 and what? 870 some.
So
we have at least 70%, if not 80% of the employees say that they would be willing to be vaccinated.
Wow, good. That's great.
Yeah, we can get the veterans over there. That's another help for sure.
Right.
I'm sure you're going to do that tomorrow.
Yes, it's going to go out tomorrow. Like I said, we're going to have a count before lunch.
Okay, great.
I think no matter what plan we come up with, there's so many uncertainties. We don't know if the community spread will spike again or if it's going to even out or become less. So I think whatever we do, we will have to follow the attestation guidelines that if there are positive cases, then yes, classes and schools may need to be quarantined for certain periods of time. But all the guidelines with social distancing, masking, and so forth. But also, I was wondering if we've looked at other mitigation factors, such as air purifiers and things such as that I know are being mentioned by President Biden's team. They talk about opening windows, which you can't do. But we have many of our special needs populations that the children just can't, or you can't keep masks on them, you can't maintain social distancing. And I think any way that we could provide protection to staff and to students would be extremely important as we move forward.
Well, first of all, we've got the air handlers exchanging air as fast as they possibly can in all the buildings. That's one. Two, all of our special needs self-contained classrooms will have a UV disinfectant light air purifier that basically recycles the air in a room 21 times an hour. Each one of those rooms will have that because those populations have issues with masks, etc. And that way, those rooms will be in and of themselves. They'll be a lot more disinfected than any other places. So yes, we've taken a real strong hard look at the special ed populations that would be in that situation.
Excellent. That's great. And I think that's more assurance for everybody, you know, parents and everybody that's involved, you know, that we are taking those extra steps. That's great. And I assume let me think, the early childhood, I used to call it the curtain program, but you have a different name for it now that it's at Washington Jefferson. But the preschool children, those classes are taken care of also.
We're looking at those, yes. We're working on a class count. The PO went out. The biggest thing with some of these things is you've got to make sure what you do is solid and it's going to have value, because you just don't want to waste money. I think we're in good shape with these, and we have extra units coming in that'll also include Lex, at least their 5-day week classes or their all-day class. So, I mean, it's just a question of us finalizing the numbers.
The other piece of this, we had talked about our special populations. We had provided the board with a list. So whenever we decide to return at any level, our special populations will be returning to full live instruction on a 5-day basis. And any student that Mrs. Sanders in our special education department is working with that requires or needs, that is not in a special population group that needs full 5-day instruction, that will be worked into their schedule as well. So that would be part of what we would recommend moving forward.
Yes. At this time,
Can I ask a question?
go ahead.
So before, I don't know if we're making a motion what you're going to do, but I had a suggestion here. If we go hybrid for even the high school, that the even grades would go on one day and the odd grades would go on the other day. So like 10th and 12th would go one day, 9th and 11th. So all the seniors would be together for the rest of the senior year. I don't know if that's possible, but
The challenge with that, when we made the adjustment to the schedule and the recommendation that we had, is we have to adhere to CTC schedule. So the recommendation we would make in a hybrid model is that A, students would attend every Monday, every Wednesday, and every other Friday, and B, students would attend Tuesday, Thursday, and every other Friday. Reason being is that when you have students in multiple levels with childcare and assistance at home being an issue, we need to have a continuity for families. And then we allow flexibility that if there's students with different last names or different groups to make sure that they're going on the same days. Plus that allows us to adhere to the CTC schedule because those students are either they're Monday, Wednesday, and they're virtual on Friday, or Tuesday, Thursday. So it allows us to maintain continuity with the CTC, which was an issue when we were doing the rolling just every other day consistently. We'll get a calendar out to all families, whether their student is A or B, with a definitive, if we are still in hybrid, these are your hybrid days and these are your non-hybrid virtual days. It would be a real challenge. I mean, it would create probably more problems than it would solve. But once again, I think the hope is that if we get our community transmission level down to that 100 or under, we can have all students back full time sooner than later.
And what's the hybrid model going to look like again? Monday, Wednesday, Friday?
Monday, Wednesday, every other Friday would be our A group. Tuesday, Thursday, every other Friday would be our B group for live instruction. The off days, they would be engaged virtually during those days.
Okay, so they're going to have class every day.
Yes.
They're
Yes,
in school or out of school.
Correct. So what that looks like in secondary is you are either sitting in class in front of the teacher, or you are live streaming that class on a virtual end. Elementary is a little bit different. You're either in with the teacher, or you are receiving your instruction through prepared videos and other activities on the off days that are then followed up with the elementary teacher the very next day.
But there might be some adjustments to that.
The way we're setting it up, understand that we're not doing, okay, day one, day two. We're doing 1, 2, 3, 4, 5, which means we're going to cover 5 days of lessons, 5 days of curriculum in 5 days, whether they're in class physically, at home virtually, or in class physically or at home virtually. 5 days of instruction. Tests, Friday tests are going to be a little different because that's something the teachers are going to solve. And I have the utmost confidence that they'll be able to figure that out. But we have been moving through our curriculum steadily.
They've been very creative with assessments. Like, for example, to make it continuity, they'll give the same assessment to their live students and to their virtual students through a virtual platform, but the students that are live are doing it through a Google form or through some other platform that they have available to maintain consistency and fairness to all the students and still keep it moving. As Dr. Priotel said, we are still expected to cover the curriculum throughout this time frame. So we can't have pauses where we're only teaching every other day. We have to be moving through the curriculum and making progress on a daily basis.
Our goal has to be getting kids back full face-to-face instruction. And I think the board should discuss any motion, including the parameters that would be used to get kids back full-time, face-to-face.
Okay, well, I think that we should try to start on a hybrid plan starting on February 1st if we're able, and moving to full return when it moves. I think Dr. Gates said optimal was less than 5%. So if we would move to a full return when the rate drops to less than 5%. It's at 7.9 right now.
I'd like to, you've answered most of the questions that I had, but I have two things that are just statements. I am a little concerned. It's good to hear that the transportation will be ready on the 1st. The food service, the cafeteria didn't sound as committal. As sure as that would be good. I really don't want to screw this up. I'm all in favor of bringing people back hybrid. I don't know. My thought is that February 8th may make a little more sense to give them a little more time. That's just my opinion. I'm also, and you've heard me say this before, and you're probably sick of me saying it, I think we have to walk before we run. I'm in favor of a phased reopening. I would like to see elementary, that's following the PDE, Department of Health guidance, that they're saying bring them back hybrid now, that's fine. We heard great numbers tonight. It's very promising. I'd like to see us bring elementary back February 8th and secondary on the 22nd in a hybrid. I just think we need to do a phased reopening, play it safe, see what impact elementary is going to have on those numbers. If they remain stable or continue to drop, then I think we made a good sound decision. I just think bringing every student back hybrid on one day, I think it might be a little foolish at this point.
Well, the teachers wanted, there's 58% of teachers wanted everybody, whatever our decision was, elementary, K through 12, they correct, Brad, they want everybody back.
That was correct. Let me just clarify that. And when they said everyone back hybrid, they were referring to the staff. So what they would want, so if we would look at a phased reopening with elementary, we would also look at our secondary instructional staff returning to their buildings for instruction. So if we would look at February 8th as being elementary hybrid returning instructional staff and students, we would also have secondary instructional staff returning to begin to deliver instruction from their buildings on February 8th as well. That whenever we were back, that we would be back K to 12, pre-K to 12.
I think we need to bring all of the students back in the hybrid model, because if the parents are correct in what they're saying when they were calling in, some of their students have been in school a total of 5 days this entire year. And we are in.
No, that's 5 days since last March 13th. My kids have been in school 5 days since last March 13th.
Oh, so that's even worse. It's almost a year.
Yeah, it's not.
And they've been in school for 5 days. I don't think we can shortchange them. I think we need to get these kids back, and I can go along with the hybrid. And then as things improve, vaccines are given, we can get everybody back face to face.
Does anyone talk to you about staying the way it is? Has anyone ever said anything to you? I don't know about most of you, but I get both sides.
Oh,
I just don't get one side.
I've gotten some.
And you know, what do you do? 50% want this, 50% want this.
But they
I
can
agree
do
with
it.
Bakes. I think you start out slow and then in a couple of weeks bring secondary back. I think that's realistic. I mean, you're safe. You're playing it safe.
But Dave, we're not forcing them to come back. If they want to
I
do
realize
virtual
that,
the rest
but
of the year, they
what
can.
happens, if I'm not mistaken, the bus drivers drive secondary, then elementary, correct? Now, what happens if a secondary kid gives a bus driver something? What happens there? That bus driver is not protected. Let's take it slow. Let's make sure we do something right. Let's not rush into things.
Well, and allow me to piggyback on what Dave just said. I think everyone knows my thoughts. I think we remain virtual, period, until we get everyone vaccinated and have our staff completely protected before we decide this. But isn't Hollidaysburg and Tyrone in Blair County, aren't they part of these numbers we looked at? And I've talked to my friends in both districts, and their districts are a mess right now. I think Hollidaysburg has 250 some kids on quarantine. They've shut down a lot of classes. Tyrone shut down completely. We're getting excited about these numbers, and they're good numbers. But guess what? The reason why their numbers are and why they're going into quarantine is because they brought their kids back. This is an issue that we have to look at other school districts around us and what they're doing. And when things go south, I think Hollidaysburg made it what? Was it 3 whole days before they had big issues? So let's not look at this like we're Pollyanna, because the numbers are going down, that it looks great, because it doesn't. I want to stay virtual until we get our staff protected.
Rick, I agree, stay virtual, but it's unfair for our kids. Parents want their kids back, and I agree. We have to get them back. We can't wait till March 1st or April 1st. They have to come back, and it has to be. I personally think Mike's way of doing it, K-5 for a couple weeks, then bring secondary back.
So my question is, Dr. Gates said it's hot off the presses, K through 12. So that's one thing I want to know. Second, every school building is a different building. It ain't like we're putting all the elementary, all the junior high, all the senior high in one building. So I don't know why you can't bring them all back and see how it goes. And the other question is, why don't we bring secondary back first instead of elementary for a change? I don't understand that. Like, why can't we bring them back first?
And just kind of referring to what Mr. Baker said, the recommendation from the state and Dr. Levine, because of the age of the children and the research that is out there about transmission, the recommendation is because those students seem to deal with the virus and exposure better than older kids. The recommendation was for elementary students to be returned first, and then you phase in your secondary students. So what we were looking at is the recommendations based on DOH and the state, and falling in line with that, which is why we were initially, we put a motion forth for elementary return and then have a phase-in secondary return. That was our thinking. That was based on the information that was provided to us. I know what Dr. Gates had referred to this evening in terms of numbers, but I would say that, what we have seen is that, and I wouldn't disagree with him, that there wasn't a lot of spread in school once kids got in from kid to kid, but it's being brought in from the community. So when you look at community spread and you look at how that's impacting aides and teachers and cafeteria workers, that then exposes our student body to that. And we're going to continue to have that. I think as Mr. Francis alluded to and Mr. Hoover, other districts are now dealing with that in terms of, we can take every measure we can within schools to make sure that it is a safe environment here. However, we can't control what happens when students leave our buildings, when they go home and they're exposed in large group settings or whatever it may be. That then subsequently can be brought into the school setting. So by using a hybrid model, you're cutting that risk in half by the number of students that are attending on a daily basis. Now, yes, they're attending every other day. So those potentially exposed kids are going to come eventually if they're coming into face-to-face instruction. However, you're reducing the possibility of that exposure on any given day. And in terms of our numbers, if you look at the table that we provided within school enrollment numbers, with those numbers, especially in areas like cafeterias where they are going to be unmasked, and even in classrooms where we have students 18 to 22 in a full setting, especially at elementary because the rooms are smaller, you will not be able to social distance. I know when Hollidaysburg was going through this, they flat out said, we will not be able to social distance. And I think, that may play a role in what happened with their closure. But make no doubt about it, we are going to have quarantines. We're going to have cases. We're going to do everything we can do to prevent and mitigate that. And we will follow through with whatever happens in terms of, our contact tracing. And if we have to quarantine students, they've relaxed some of the quarantine lengths as well. So that's another thing, that's showing that the numbers are getting better and that the research is getting better. They're getting more information that they can base this on as to what is safe. So, we've already had it with athletic teams where we've had a positive case. We had to shut down our 7th and 8th grade boys basketball teams for 2 weeks. So
that Dr. Fauci report, does it say up to age 14 or something?
There is a provision in here, and I can just read it to you. It says, notwithstanding susceptibility of adult populations, a recent meta-analysis indicates that children younger than 10 to 14 ages have a lower susceptibility to SARS-CoV-2 infection than adults opening a new window. It does kind of say that, 10 to 14 then, as Mike had alluded to, are not necessarily, they're not as not at risk as elementary students.
Well, they talk about that, but you look at some of our elementary schools where they have a great number of grandparents as the main caretaker. That becomes an issue, and I think the idea of phasing this in, doing it the right way, consistency is a major factor for kids, and we want to do this right. We want kids back in school. But let's do it cautiously. I know many parents out there are going to say, well, if you're going to get them in, get them in. We've been telling you that all along, that the virtual learning is not working. We realize face-to-face is the best instruction for all children. It's the best for all teachers and staff. And we're dealing with a pandemic. And let's do this so that it's safe as can be made possible.
Okay, then what about if we start next week with elementary? We have enough food for elementary kids. We may not have enough food. Is that correct, Sue? Would we have enough food to feed the elementaries next week in a hybrid model?
What we're going to struggle to get is the president, those types of things. I didn't want to.
Right.
So you're talking pasta, sauces, things like that. So by the 8th, could you have that with another week? The first is only, today's Tuesday, right?
Well, I know. I'm
Wednesday,
saying
Thursday, Friday. That's not a whole long time.
Okay, Mike, I'm trying to make a compromise. I'm saying let's get elementary back in next week, and we'll start with the secondary the following week, the 8th. That's phased. That's what you're asking for.
It's a 2-week phase, isn't it?
I'd prefer two. I'm if we could get them back to first, and Susan said, yeah, we're going to have everything we need to give them the meals that they deserve. Remember, a lot of them, these are the meals they get, and that we're not giving them a good square meal because we have, things with long shelf life, like bomb shelter stuff.
Some of them aren't getting meals at all right now. Whatever we can provide, we're
I
providing.
Completely agree. I just want to get it all. My point is, I want to get it right. And you're talking about 3 days to get this ready.
For half of the population and in a hybrid model.
That's what I'm asking.
Okay, I'm saying that's what it is. It's half of the population.
Is this something that can happen by Monday?
What is your order time for fruits and vegetables? What is that basic time when you order and when you receive?
There's 2 things that we probably ought to consider. Transportation is ready to go. So our drivers know the routes. I think we have drivers that are ready to go. What we haven't done is we don't have full notification to all families because it's just been so ambiguous. All the buildings have those transportation lists. So that's going to be a scramble. I'm going to be honest with you, because it's the same transportation the kids had in that 5 days that we were back in November. So it would be that same transportation information.
What about if we started on Wednesday, the 3rd then? Would that give a little bit more time?
That gives us a little bit more flexibility. The normal fresh food deliveries are on Thursday, and you have to order it the week prior. So normally our food delivery would be tomorrow, or yeah, tomorrow, because we don't, or Wednesday, Thursday, and you'd have to order it last week. So we don't have time to have it delivered to us. The potential exists that we can will call it. The problem is that our suppliers aren't housing it either, because they have limited supplies on hand, because restaurants aren't stocking the way they were. Other schools aren't stocking the way they are too. To answer your question, more than likely we can get fresh fruits and vegetables for the elementary buildings. There's a high probability we can at least get it for a couple days for the secondary schools, but it's not going to be the selection that our students are accustomed to.
Wouldn't life be easier if we opened on the 8th?
Yeah,
It's a week, yeah, and I know someone said about bringing the secondary in before elementary. Didn't our neighbors do that and their secondary went down?
And I'd recommend really strongly considering a return plan that looks at long-term in terms of let's develop a plan that gives us the greatest chance to have limited disruption then moving forward. So if we look at a phased-in hybrid return model, does that give us the greatest likelihood of not having to have closures, of not having to have excessive quarantines? And some of that's unknown. But in reality, if we can do a phased stepped-in plan, that would likely lead to the greatest probability of continuing to move forward to having kids fully back in school without further disruption, in their learning model.
Can we get 10 days then after that, like the 17th or 18th, even just get them going? I mean, as soon as
From a
possible.
deliverability, we can make it happen.
holiday,
It's just a
right?
matter of what the board decides that you want us to do. We can have it ready.
Well, can I point out the fact, and we talked about this last week, we talked about how our teachers are our most precious resource. And we know that without teachers, we have no education. And I keep coming back to it, and you guys, people can roll their eyes, but I truly believe until we get our staff protected, vaccinations, you know what? We thought in October we were good to go. It didn't last long. The numbers look good. We can look around at the other districts right now and see what's going on. I just want our teachers, our employees protected. And by the way, someone had said before, that's not part of our job. It absolutely is as a board. We have to provide a healthy and safe work environment for our employees and a place for anyone entering our buildings to come to feel safe. That is part of our duty that we have to look at.
But the last time we had spread, it was my understanding that most likely it was brought in by the adults coming into the classroom, not necessarily the students. I've not heard of students spreading it to the adults. And these same people that you're talking about, our teachers, I'm sure are going out to dinner. I'm sure they're going to Walmart or Target or somewhere. I mean, they're out and about. It's not like they're staying at home 24/7.
Sharon, you cannot make that assumption. I know many teachers who have been extremely diligent because they want to get back in the classroom as well. And there's one more elephant in the room, Chuck, and I need to address this with you. Are we going to back our teachers whenever they enforce the mandates of masks and distancing? Because about a year ago, I went to a couple of elementary schools, and I saw what was going on there. Are our teachers going to be backed when they tell these students, you're wearing a mask, you're social distancing? Because while I was at one school, the police department showed up twice. Are we going to back our teachers?
Absolutely. That's not even a question.
And you tell me I don't know what I'm talking about, teachers being out and about. I have seen them in restaurants. I have seen them in Walmart. So they are out, and there's nothing wrong with that.
How long are they staying there? How long are they staying at Walmart or a restaurant? We went through that with Tim, I think.
Well, normally you stay at a restaurant to eat a meal.
Yeah, but are they there for 6 hours?
I don't know if they're there. I
No.
doubt that they're
You
in a
know that-
restaurant
you know
for
they're
6
not.
hours.
You know they're not in contact with somebody for that long.
A classroom is different than Walmart.
It was
But listen, Zane Gates said that the transfer rate at Walmart and the classroom is the same, even based on the time. So we are completely ignoring what Zane came and told us.
Well, that's funny because Zane also told us we shouldn't listen to the information because it's been so scattered. And then he put out information. Yeah, I don't know which to believe there, Ed.
Well, it's my understanding yesterday in this room, the teachers wanted vaccinated. They wanted to be safe. They want to get back in school, but they want to do it safely. And I know when you go to the grocery store, you're there 5 minutes. You're in the bank, you're there 5 minutes, and they're protected. The teachers were saying, hey, we're there for 6, 7 hours with no protection besides a mask. I look on the board as Mike being the education guy. I like Mike's suggestion of what to do. Mike, I'm with you on your plan there. It's we have 3 neighboring schools just shut down. You know, so now they got to go to the cleaning. So the parents already made preparations, send the kids to school. Now they're back home again. Now they're going to make new preparations. I say there's a light at the end of the tunnel. We're almost there. It's been 9 months. I don't like it either, and nobody else likes it, but let's play it safe.
I'll get on board with Mike's suggestion if we can bring elementary back on the 8th and bring secondary back after President's Day, which would be the 16th.
So could I make a motion then?
Yes.
Okay. I'd like to make a motion to bring elementary students back in a hybrid model February 8th, with secondary joining in a hybrid model on February 16th. Once those schools return to that hybrid model, the special populations will be in 5 days a week.
All teachers returning February 8th.
Yes, all teachers on site February 8th. That sounds good to me. I would also add to this that in order to come back to full-time face-to-face instruction, that we would like to see 2 weeks, consecutive weeks in the low transmission rate as per the Department of Health guidelines. That's my motion.
And I will second that.
Okay.
All right. What I'd like to do right now, 2 things. First of all, we are working on a solution to the COVID leave with the solicitor to answer a question and solve some issues that the president brought up yesterday. So we are working on that, and I'll hopefully have answers soon, just so that those people know. Okay.
Well, wait a minute. I think that we need to know that for sure. I want to know that before we move on anything.
I've got it.
You're talking about the CARES Act, correct?
What I'm talking about is not the CARES Act. The FFCRA leave is over. What I am working with Carl has done several agreements with other unions to ensure that we can maintain staffing and make sure that we can deal with any issues that may arise from either quarantine and or infection. And what I'm saying is I have it pretty much done. I just need to finish reviewing it because Carl sent me a phone book today to go over, and hopefully I will have that punched out and I'll be able to talk to the union president here within the union president and other representatives in a day or 2.
Should we be voting on this without having that sealed? And wouldn't that be part of the deal? So the teachers know what to expect if we're voting on this.
I'm gonna be honest with you. We can work this out. Because if we do this, we'll be the only district in the county who actually has it done. So I'm not concerned about that. We have things in place, and we have done certain things to ensure our faculty could continue to teach and not have issues with leave, et cetera, sick days and that kind of thing. I just want to make sure we have these pieces together so that everybody's comfortable.
Right, and it has to be vetted with the union.
And it has to be vetted with the union.
It can't be voted on tonight until it's presented to them because it's a mandatory subject of bargaining.
So then what if it's not acceptable to the union?
Then you would negotiate till you get to something that's mutually acceptable.
So
Okay, so we need a 15-minute.
Yeah. Could we do a
recess.
Oh, recess.
Recess and then public comment and then we vote.
Okay.
So everybody stretch your legs.
You're done.
I wish I could.
the motion again?
We live? Yeah. Okay, you're on.
Okay. We are about to open up to public comment. Again, the comment, because this is a special meeting, is limited to comments on the proposed reopening. The motion that was made prior to the recess was as follows. It was a motion to reopen with a return of elementary students in a hybrid mode beginning February 8th, followed by the return of secondary students in a hybrid mode on February 16th, with all teachers, both elementary and secondary, returning on site February 8th, with all special populations coming back to a 5-day full return on February 8th, and with a full traditional return occurring 2 weeks following, occurring on a date following 2 weeks in which the county is in a low transmission rate. And so for the sake of the public wishing to offer comment, that's currently the motion that's been proposed by the board and seconded.
Your call has been forwarded to an automatic voice message system. 814934552.
Hello?
Liva Marasco,
Yes.
you are on the Altoona Area Special Board meeting. This is public comment. You have 5 minutes.
Thank you. My name is Leva Marasco. I have 3 daughters in the Altoona Area School District. Actually, my oldest child was a senior last year, yet she did not have a meaningful, positive culmination of her senior year. She missed out on senior privileges, celebrations, trips, as well as her senior prom and graduation due to the pandemic and the ensuing school closures. My middle daughter is presently a junior at the high school and has attended a mere 3 days of in-person classes since school reopened. And that is due to a teacher quarantine that she couldn't attend school longer than 3 days in person since March 13th. My youngest child is an elementary schooler at Logan Elementary. For the past several months at your meetings, many parents and grandparents have phoned in and described the educational challenges and failures of virtual schooling. These individuals have begged you to return students to the classrooms and have detailed the risks of not doing so. They've explained the realistic struggles of keeping children engaged in front of a computer screen for hours at a time each day, day in and day out. You've heard their stories and the statistics about the rise in mental health issues and the decrease in academic performance by continuing on this path. I respect your time and I'm not going to belabor all of the previous arguments, but I will say this. We are 11 months into this pandemic. It was March 13th last year when the governor shut down our schools and our stores. The past 11 months has been devastating to the educational momentum of our children. At best, they are maintaining academic levels they were at in March of last year. Sadly, most public students are now months behind in their expected leveled curriculum, despite the teachers moving through the curriculum at the scheduled rate. There's a difference between moving through the curriculum and seeing students face-to-face actually comprehend the material. If you look around at our community and our state and our country, you will find that every other industry has figured out a way to function safely and meaningfully despite the risks of a virus. Look at grocery store clerks, delivery drivers, doctors, police officers, politicians, daycare providers. manufacturers. I could go on and on. My point is this: every other industry has been able to adapt to the pandemic and provide the services needed to our society. Why is the education industry the exception? After talking to many current teachers, I believe they can find a way to safely socially distance in the classroom for children whose parents don't want to send them to school. For those who don't, give families a choice. Students can remain virtual. Teachers can be provided with improved technology and facilitate virtual classes for those children who choose to remain virtual until the virus risk is mitigated. I'm a physician assistant in a busy family practice office in Altoona. Daily, I see patients face to face all day long. Some are well, many are ill, and many are ill with COVID. I see them every single day in a room 8 by 8. What if I and doctors and nurses and hospital workers and paramedics and everybody else in the healthcare industry said, I'm at risk. I'm not going to provide service until I'm vaccinated, or I have elderly parents to care for. I can't risk getting them sick. What if we, the healthcare workers, refuse to work for the best benefit of our patients and our community? Again, why does the education industry feel that it should be exempt from being an essential service? And as a final thought, during your last meeting, one of your members stated that your teachers are the most precious commodity or resource of the school district. I agree, they are precious, and we couldn't do without the teachers. But what about the aides and the custodial staff and the bus drivers and the administration? If any of you have ever attended McAuliffe Heights Elementary School opening, you would hear a chant where the teachers proclaim, "We touch the future, we teach." And then the students collectively reply, "We are the future, we learn." I would ask all of you to look into your hearts and look at the reason why you are personally sitting on this school board. Is it not because you feel that the most precious commodity and resource in this district is the young minds of our children and their futures? Shouldn't this be who you serve? Our children need to be back in the classroom. It's been 11 months. Thank you for your time.
Thank you.
We'll be closing requests for public comment. We'll be closing requests for public comment in 5 minutes.
Hello?
Leslie Travis,
Yes.
you are now speaking to the Altoona Area School Board at our special meeting this evening. You have 5 minutes.
Okay. The reason why I am speaking is because the students are suffering not being in the buildings. I have a first grader at Logan, but I also have nieces. Like I have a niece that goes to Pleasant Valley, and these children are struggling big time. They need the structure that the school provides, and with them being out of school, their grades are suffering, their education is suffering. These kids can't focus on these iPads and whatever other tablets they may have. And like the older kids can make out what they like, understand what's going on, but like I have a second grade niece and my son is in first grade, and they're both suffering. They're struggling. Like they can't focus on the tablets. They need the structure that the school provides. And it's chaotic for us parents because we have to sit and fight with, you know, like us as parents, we have to fight our kids to get them to do the schoolwork. It's not right for us to have to fight with them, and it's definitely not good for the kids. If you ask me, I think that even if it's just a hybrid 2 to 3 days a week,
in the building and 2 to 3 days a week here at home. That's more manageable, and these kids won't be struggling as much. I think that the school needs to open up. I understand that masks are a requirement, but I think that before the shutdown, things were going great. The kids were able to focus. Their grades were coming up. Now their grades are going down. And it's not fair to the children. And some of the kids are going to end up having to repeat a grade because of not being able to focus and get their schoolwork done. Excuse me, I apologize. Yeah, like my niece, she's, like I said, she's a second grader, but she cannot focus. She can't, like, it's not that she can't focus so much, it's just she doesn't understand what's going on Seesaw, and neither does my son. And I'm trying to do both first grade work with my son and second grade work with my niece, and even I'm having a hard time understanding what's going on and understanding like what the activity on Seesaw is that they need to do. The older kids can understand, but like the first and second graders, they're having a hard time understanding what's going on, and it's making them not want to do their schoolwork. And I mean, some kids understand what's going on, but like other kids, it's like they don't understand it. They don't know what they're supposed to do. And us as parents, we're trying to not just be parents and aunts and uncles to the kids, but we're also playing teacher, and that's hard enough for us as it is when we don't understand what's going on. So, it's chaotic to say the least. The Seesaw activities most of them are complicated, and like a first and second graders not understanding. Some first and second graders don't understand. Like my niece and my son have actually sat here and cried because they don't understand what's going on, and neither do we. I think the kids need to go back to school, even if it's 2 to 3 days a week. They need the structure that the building is providing. Thank you for hearing what I had to say and listening to my concerns. I hope that the students can return to school.
Thank you.
Thank you.
They should.
Elizabeth read it. I just read it out loud.
Billy Joe Torreyson.
This is our plan, this is what we're going to do instead of being here for an hour and a half.
We did that.
Maybe you should, do you want to tell each person when you call? If we haven't voted them. They might not be watching. Maybe you should tell them each, but we haven't voted.
Hello, this is Matt.
Matt, this is Dr. Prietel with the Altoona School Board. Matt, have you heard the motion?
No, I haven't.
The motion on the floor is to return in a hybrid for the elementary on the 8th of February and for the secondary on the 16th.
Okay. Well, thank you very much for the information. I appreciate your call.
Thank you. You have a good evening.
Thank you. You too.
Good idea, Ron. Excuse me. Don't tell me I need to do an intervention, Ron. Hold it together, boy. Hold it together. You can do it. Okay, let me get this one right.
Your call cannot be completed as dialed.
Believe me.
And dial again.
Come on, give me ready. I mastered my numbers in second grade. Trust me, I did. Honest.
Hello?
Hello, is this Alexandra Sanchez?
Yes, this is her.
This is Dr. Prietel with the Altoona School Board. First of all, I want to tell you the motion on the floor. Do you know the motion that's on the floor?
Yes, I've been watching.
Okay. Just public comment, and you have 5 minutes.
Okay, thank you. I appreciate everybody listening. I just have a couple comments. I hear everybody going back and forth about the elementary school and the secondary. I do agree that the elementary should go back. Regarding secondary, why can't we throw the option of 6th through 8th grade doing the school, like going to school, whether it's a hybrid or not, keep the 9th through 12th graders on virtual until we get down to, I think, the 7% or 5%, I think is what Kelly said earlier. That's just a suggestion. And then you guys were talking about 70% of the faculty saying yes, they'll get vaccinations, but you guys aren't being specific. Is it 10% at Logan, 3% at Ebner, 20% at the junior high, 10% at the high school? That's what you guys aren't really relaying to us as a community. And then really the last thing I have is about the sport. My daughter's in sport. She loves the sports, but she wants to go back to school. However, the sports portion, they're competing against other schools, other kids from everywhere. So allowing them to play sports is great, but getting them back into the school should be the same, because you're already letting them out there contact sports with other kids. You just had junior high basketball teams go out to state college. Why can they go there, but we can't have the kids go to school? That's the only comments I wanted to say. But I really appreciate you guys giving me a call and give me an opportunity to say a couple things. So have a good night.
Thank you.
Hello.
Hello, is this Doug Rosenberry?
Yes, it is.
This is Dr. Prietel with the Altoona Area School Board Special Meeting. Are you aware of the motion, Doug?
Yes, I am.
It's public comment. You have 5 minutes.
Thank you. So this pandemic has certainly been a challenge for all of us. Certainly, I mean, educators included, as we've had to modify our craft really in order to continue to provide instruction to our students. But I think it's important for you, the school board, and the community as a whole to know that the teachers of the Altoona Area School District want to do what is right by our students in every way, every way. We want to provide them with the best education that we can, but we also want to provide them with the safest education that we can. These two goals have been colliding lately, unfortunately, due to this pandemic. And again, we are in the middle of a pandemic. I ask that when you consider what our educational delivery will look like in the coming weeks and months, that you err on the side of safety for everyone. Students, yes. Teachers, yes. Support staff, yes. And our loved ones at home as well. I also ask that you consider equity from the bottom up so that all of our educators and educational support professionals are provided with the same protections. If it's not safe for secondary staff, then it's not safe for elementary staff. I know that we as a community will overcome these challenges, and I know that our teachers and staff will continue to do their very best for the benefit of our students. This is more than just a job for us as teachers. This is our calling. We look forward to maintaining our partnership with the parents and other stakeholders in the community and providing the safest opportunity for our young people that we possibly can. Thank you.
Thank you.
Hi, you've reached the cell phone of Donald.
Give that one more shot here.
Hello?
Hello, is Miley Noggle there?
Yes.
This is Dr. Priatel with the Altoona Area School Board. This is public comment. Are you aware of the motion on the floor?
Yes.
Okay. Would you like to comment? You have 5 minutes.
Yes. Okay. Thank you, school board, for taking the time to listen. I would like to share with you my concerns and hopes for my education. I'm currently a 7th grade student who would love nothing more than to return to school face to face. Yes, I understand the concerns for safety and the need to follow certain guidelines that are set, but there are so many more reasons that all kids need to be in school with their teachers and friends. First, I would like to say I am hoping that the plan you have come up with is for all students K through 12. We all deserve a chance at a face-to-face education, being able to socialize, and to have some normalcy back. I'm only in 7th grade once. This time is important now and for my future. I have amazing teachers that are making the virtual learning work, but it is not the same as face-to-face. I don't have the resources or support that I would have if I were in the classroom. Even though I am not struggling with virtual learning, I feel that I could be learning and doing so much more if I were able to be back in the school setting. Please understand that not only do younger students need to return to school, all students are in need. As I was listening to the meeting tonight, a board member asked about sports. Playing basketball has been very important to me, but now so more than ever. I get to interact with my team and have an outlet to help me through this time. We wear masks during practices and we are taking all safety precautions. I only have 14 girls on my team and 2 coaches. Please consider the small number of people interacting during this time. I ran cross country in the fall and had many friends that played soccer, volleyball, and football. The secondary students were virtual then and the risk was the same as it is now. If I heard correctly, Dr. Gates said that our age group is rarely affected. I think your focus should be on how to give more back to the students and not take more away. I would also like to remind you that elementary students and secondary students attend different schools, so phasing, as you said, will not make a difference. I hope you truly take into consideration the opinions of the community members calling in. Our opinions and views matter too. So I'm asking you to please consider all students when you make your decision tonight. Thank you.
Thank you.
Miley, you did a wonderful,
Yes?
you did a wonderful presentation tonight, and to know that you're in 7th grade, that's wonderful. I appreciate you calling us and sharing that information.
Thank you, Miley.
Thank you. I listen to my opinion.
Hello?
Nicole Noggle.
Yes.
This is Dr. Priatel at the Altoona Area School Board meeting. It's public comment. Are you aware of the motion?
Yes, I am.
Okay, you have 5 minutes.
Good evening. I just wanted to reiterate some things that the information you guys were given this evening. Again, at this point, the vaccine is something that unfortunately really needs to be put on the back burner when it comes to your decision this evening for getting the children back in school. Yes, they are saying that it could be in 2 weeks, but you know what? 2 weeks ago, they told you the same thing, that it could be in 2 weeks. We cannot take that into consideration, unfortunately, at this time. I also wanted to address that you guys were also told this evening not to take the vaccine into consideration. Twice you were told that. You were also told to try and keep opinions out of it. You guys have been given lots of information, scientific evidence, and I encourage you all to take that more so into consideration than your own opinions. I have a child in elementary school, and I have a child in the junior high. I feel like you're placing more emphasis on elementary and getting them back in school. My son's education is no more important than my daughter's education. They're both very important. They both need to be back in school for face-to-face instruction. That's all I had this evening. Thank you.
Thank you.
Hello.
Adam Lidwell?
Yes.
This is Dr. Priatel, the Altoona Area School Board meeting. Are you aware of the motion on the floor?
Yes, I am.
Okay, it's public comment. Yes, go ahead.
Thank you. The consideration is to not only the students, pre-K through 12th grade, but the teachers, all faculty, which everybody's under the understanding, safety first, everyone. I feel really bad that the students aren't in there missing a lot of memories that they're never going to get back. But unfortunately, with circumstances, we have no control of that part of it. My concerns are, if we don't have teachers, we can't have school. With the students coming back, the percentage increases drastically of COVID spreading. You say you have a plan in place to pay the teachers if they contract the COVID and they're off, that they will be able to be paid or have paid leave. Does that also include the lunch workers that are part-time, non-salary, substitute teachers, the aides, bus drivers? A lot of the problems we're also seeing is the school board. They talk a lot about how they support the teachers. Everything that I've been watching on the meetings, and I've been to a lot of your meetings over the years, and the school board, in a way, bashes the teachers very much so. Not all of them, but it goes on. There's no representation of a group gathering between the board and the teachers. There's always somebody bucking the system. We need to stand behind these teachers as a board, as a community, because there's a lot of resentment that goes on with parents towards these teachers. And these teachers are your public face when they're out at events. They're everywhere. Parents know who these teachers are, and it goes on. The teachers and the staff, everybody at that school, they love these kids, very much so. They want to return, but they want to return with the vaccine and safe. We can't come back unless we have a 100% plan, and it seems like we're shooting from the hip, that we want to come back with maybe a percentage of the vaccine. And from what I've been hearing tonight, we want to bring people back in anywhere from 5 to 10 days without a vaccine. Numbers may be on the decrease in Blair County, but as we see the schools around us, they've been back in school, they've been out of school, in school, out of school. All we're doing is disrupting these students. They have a common routine right now that is in place. And if we pull them back and forth, it's only going to make it worse on the students. It makes it worse on the teachers and the employees. It's just a vicious cycle that we're going to create. What about what's going to happen to any of the staff that is not eligible, maybe due to a health reason, to get the vaccine? How are we going to protect them from getting COVID, contracting COVID? I mean, we're looking at 20% plus that said they're not getting a vaccine. I mean, that's a large percentage. Yes, 80% is great if that falls through, but 20% is a lot of teachers also, a lot of employees. What's going to happen there? And if you bring back teachers vaccinated and you don't bring students back, there's still a big chance, hey, that's great, the teachers may not get sick, but if you get a classroom or a school that needs to be shut down, you're looking at hundreds of students that you're throwing back at home. Now they're going to contract COVID to their parents, possibly grandparents, caretakers, and so forth. We're taking an awful lot of chance here for what we think we're going to do and bringing kids back. Yes. Are you a babysitting service? Absolutely. Is it what we want to be bringing students and teachers back into? I mean, you got to remember too, you're saying that you have items in place to keep masks on. Well, pre-K through about 6th grade, you can't keep masks on students. You're dealing with situations where the kids are spitting on teachers. The teachers are wiping noses. Maybe in some of the younger situations, they're changing diapers several times. You know, they're walking through hallways. They're using handrails that have spit on them. There's the situation in the classroom that you can keep safe to a certain percentage, but there's a very large percentage that you have no control under. And I think that's something that you need to consider.
Thank you,
the
Mr.
larger
Lidwell.
situation here.
Mr. Lidwell, that's 5 minutes.
Yes.
We appreciate your
All right.
comments.
Hey, thank you very much.
Evening.
Hello.
This is Rachel Beagle.
Yes.
This is Dr. Prietel here at the Altoona Area School District School Board meeting. Are you aware of the motion on the floor?
Yes, sir, I am.
Okay, it's public comment. You have 5 minutes. Go ahead.
Thank you. First, I'd like to say thank you to those of you trying to get our kids back in school. I am a mother of an 11-year-old 5th grade boy who has been an honor roll student since kindergarten, -1 marking period, since he started school in your district. As a kindergartner, my husband and I chose your district to raise our child in because I was an AASD student. Since virtual has started, my student is now on the verge of failing with 79% and low 80s. My student is an athlete with a medical condition that if he were to get COVID, could end up hospitalized. However, I am willing to accept that because my student needs face-to-face. I'm sorry, excuse me. Even if it is only half of the week, the board has failed our children since this started, and it's only getting worse. My child and several other students with higher grades prior to this event are in trouble because you as a board are failing our children. Children of this age cannot grasp the concept that they are now at home to play and learn. They are in their comfy clothes in the comfort of their own home, being asked to learn and absorb the impossible. I have seen your teachers on social media at gatherings posting pictures in large groups. I have seen them in public at retail stores with friends. I also know of several teachers who have gotten second jobs in restaurant services and retail. All this is acceptable, but we can't have our kids back in school. For what reason? We pay the district to provide these kids with the best possible education, and some of you have failed them. I'm begging you, as a mother of a child suffering that has a medical condition, to make the best decision for every student in this district and stop failing them. Even if it is only hybrid, something is better than nothing. Our students deserve this. This board is failing every student's future because they are falling behind. Will they ever bounce back? When is enough is enough. It's time to get our kids back in the atmosphere they learn best in. I am begging you, as a mother of an athlete and a student that gets good grades, to please get our kids back in school on this hybrid plan. That is what they need. I thank you for your time.
You're welcome. Thank you.
Hello?
This is Tara Steinbugle.
Yes, it is.
This is Dr. Prietel, the Altoona Area School District School Board meeting. Are you aware of the motion?
I am.
Okay, public comment. You have 5 minutes.
So, I've called in quite a bit. And, what I honestly want is 5 days in person.
I've been very vocal about that. But I would concede, to a hybrid if Mr. Cruz's proposal would be something that could be discussed, even if it's only on the secondary level. So you have even grades on A days, odd grades on B days. You can get together, get CTC on board. It just takes some thought. It could work. At least give these secondary kids some sense of normality. Give them something to look forward to. My fear is they're not going to be back in school. I know you talk about the hybrid, but that goalpost keeps getting moved. So it's, the vaccine, then it's going to be hybrid. Well, then, 2 more weeks until the vaccine, until 50% of the staff is vaccinated. My fear is they're never going to get back in school full time. Local private schools around here, yes, their class sizes may be a little smaller, but 20 kids in class all day with a teacher, they're doing it. Has anybody on this board reached out to other schools, other school districts that are doing this successfully? Would plexiglass around teachers' desks be an option? Teachers stand in front of the classroom delivering their curriculum to the students, maybe put them behind plexiglass like the cashiers at Walmart that they have, where they interact with hundreds of people over an 8-hour time period. I don't know if that would be something that would add an extra measure of safety or security for the teachers. I am an educator. Yes, teachers are a very precious resource, but our kids are too. So, my ask is give them something to look forward to. Going A through K, going L through M, you still have children who are sitting alone in the lunchroom because all of their friends have a different last name than they do. They're sitting in a class with maybe 4 people with whom they don't know, or they don't socialize with, or don't have anything in common with. So if you're looking at the hybrid, please try and explore Mr. Cruz's proposal a little more. That's all I have. Thank you.
Thank you.
Hello?
Hello, is Ina Krasansky there?
Yes.
Hello.
Ina, this is Dr. Priatel here at the Altoona Area School District School Board meeting. Are you aware of the motion that is on the floor?
Yes, sir, I am.
Okay, it's public comment. You have 5 minutes.
Okay, thank you very much for your time. I'm really kind of concerned. I understand teachers are a very important resource, and I understand that, they have their safety issues, but parents who send their kids back, we also are taking that chance too. My daughter, who I'm helping to raise, is in 6th grade. Straight A student from the day that she hit school. Right now, she is barely managing a C. She is very much struggling, and she's in academic classes. She just gets her side and that kind of thing, and still struggling. I understand the fact that, a lot of these people, and I'm sympathetic that there isn't enough of that, but it's still very unfair for our children to have to struggle when, for me, some of my memories were being in school with my friends and the teachers. And this COVID is a whole new thing. But at this point, it's just, these kids are suffering. I really believe, I'm even okay with doing the hybrid. when all this started, I wasn't okay with the kids coming back until I watched three grandchildren sit and cry over their computers because they didn't understand or the computer wouldn't log in. Kept having login problems. I had kids that I didn't know how to send in excuses for them. It's been a big, long struggle. And I do honestly, like somebody had mentioned sending 6 through 8 back too. I absolutely agree with that. And I'm not saying that we shouldn't send the high school kids back, but they are able to better understand a little bit more, whereas my 6th and serious is struggling. And there are days where I have to fight to get her out of bed because she's and it's just, I really want to see a change. And I think that hybrid would be an amazing choice. And I understand that everybody is looking at sending elementary kids, which I don't know because elementary are more and hugging and that kind of stuff.
We're having problems hearing you. You're breaking up.
Hello?
Donald Tantius?
Yes.
This is Dr. Priatel here at the Altoona Area School District Special School Board meeting. Are you aware of the motion on the floor?
I am.
Okay, it's a public comment. You have 5 minutes.
Hi. Thank you for your time in this matter this evening. My wife and I are both currently homeschooling our 2 granddaughters who attend Baker Elementary. Both of us are former educators for 35 years, and we understand the struggles that are going on right now with everybody. I, as a former teacher, and my wife, we don't understand how other people are doing this. I mean, the normal everyday person who's out struggling in a job, I don't know how they're coming home and also doing the whole day worth of school. Also, the fact that you have high school kids doing athletics right now. What is the difference between high school kids and the elementary kids starting at the same time? I don't understand the gap of the week wait between elementary start and the senior high start. That doesn't make any sense. And then you'll talk about the vaccine. 2 weeks, it takes 2 weeks for a shot. So that if you have to wait for the vaccine, there's another 2 weeks, another 2 weeks. We're pushed back until end of March sometime. So I just don't know if the school board is really taking the effect that this is not only affecting the kids, but also affecting the other members of the community. Thank you very much.
Thank you.
Hello.
Dennis Howell?
Yes.
This is Dr. Priatel here at the Altoona Area School District School Board meeting. Are you aware of the motion on the floor?
I am.
Okay, this is public comment. You have 5 minutes.
I'd just like to begin by saying thank you for listening to me. From the beginning of this virtual or children, I have 2 children that are in elementary school, kindergartner and a 2nd grader. They have not had a regular schedule since day one. The schedule changes all the time. My kindergartner always has at least double the work of my 2nd grader, and both of them need help. Neither one of them are focusing very well. There's too many distractions in the home. it doesn't matter what we do to try to keep them focused. They get so distracted. They're missing half of their Zoom meetings. They don't want to do their work on Seesaw. It's very frustrating as a parent. And I know that my wife's grandmother, who has the kids 3 days a week, is also very frustrated with it. She called to the last special meeting. One of your board members seems to be so hung up on the vaccine that it is causing him to think irrationally about how to make his decision. These vaccines are not going to be here overnight. They are going to take time. Your last special meeting that you had, you were given erroneous information from somebody who was not a doctor. I know this to be true because I spoke to the doctor who is in charge of most of the doctors in the hospital that are dealing with the COVID, and he told me that those numbers were incorrect. They were high. Our kids need to be in school. Even if it's a hybrid model, these kids need to be face-to-face in school. Over a month ago, Department of Health recommended that elementary students return to the classroom. The other thing that has really frustrated me is seeing posts on Facebook about our sports teams are doing this. If kids can't be in school, there should be no sports right now. Thank you for your time.
Thank you.
Hello?
Pamela Stump,
Yeah.
this is Dr. Priatel here at the special board meeting for the Altoona Area School District. Are you aware of the motion on the floor?
Yes, I am.
Okay, it's public comment. You have 5 minutes.
Hi. First of all, I'd like to thank everybody for allowing me an opportunity to speak this evening. And I'd like to thank the teachers. They are doing an outstanding job, and they probably do not hear it enough. My opinion of this whole situation has went back and forth, like I feel many people's have, but that's just what it is, an opinion. And I think, like so many before me have said, we have to leave the opinions out of this and look at the effects on our children. I work as a social worker. I have a 5th grader with an IEP and a 7th grader who is an academic student. I will say this, I feel like the middle schoolers and the high schoolers need to go back. If we look at developmentally where those kids are at, interactions with their peers are developmentally important right now. And these kids are not getting enough interactions and socialization with their peers. It's vital to the development. I've seen my 7th grader go from a straight A student to a child who doesn't want to wake up in the morning. And it's not because of the teachers. The teachers are doing an outstanding job. They've contacted me consistently, but it's taking a toll on our family. I have to work. I can't monitor my child all day, be in front of him all day to make sure he's on the computer. And I can't provide that motivation that socialization provides my child with. Athletes are very important, and my children do participate in sports like so many have. And I don't think we should take away sports, but I do believe we need to get these kids back in school immediately for the socialization. Mental health concerns are becoming more and more prominent with our kids. I don't want to see my kids not want to wake up in the morning. That's a sign of depression. That's a sign that something's not right. And I'm hearing it from so many parents that there's so many kids that are sleeping all day, that are refusing to get on the computer to do their work, straight A students. Even kids with IEPs need that socialization too. So I just want to reach out to everyone and tell everyone that yes, the teachers are doing a wonderful job and they're accommodating and they're working and doing what they need for these kids.
And it's very important that they stay healthy, but it's also important that we take into consideration people's mental health and these kids' mental health in this situation. And thank you for your time.
Thank you.
To transfer.
I don't know where I would transfer it to.
Hello?
Kathy McKillop.
Yes.
This is Dr. Pretel at the Altoona Area School District School Board meeting. Are you aware of the motion on the floor?
Yes, I am. And I just have a quick comment. I agree with what's being said tonight. A lot of people want their kids back. I do. My comment is if 50% of the parents want their children in school and 50% want them to stay home doing virtual, why not bring the kids back that the parents want them back? And that would save on the the distancing problem that you're having. And the teachers also could do a streamline to the kids at home. They're doing virtual at the same time. I just agree. I just feel that the kids need to be back. They are suffering emotionally and mentally, and their grades are falling. They're distracted. They're at home in an environment that they are relaxed. They don't think they have to be attentive. But I do think if 50% of the kids go back, that the parents want them to go back, you would have half the amount of kids in school, and that would save on the problem of overcrowding until the numbers come down. So 50% could stay at virtual that want to, and 50% go back. And that's all I have to say. I'm for all day going back to school, not virtual, or not hybrid.
Thank you.
Oh, thank you.
To transfer.
I'm not transferring. Now, we are.
Hello?
Hello, Eric Smith?
Yes.
This is Dr. Pretel at the Altoona Area School Board special meeting. Are you aware of the motion on the floor?
Yes.
Okay, it's public comment. You have 5 minutes.
Yeah, I guess first of all, the guy that's on Zoom every week constantly has to attack
excuse me,
the older lady and the
sir,
just listen, has to attack the older lady, be a board member,
sir,
and solve the issues.
Sir.
Second of all, as far as the motion on the floor, I work and drive truck. I leave Monday morning. I get home Wednesday. Wednesday night, my wife works. I leave Thursday morning. I get home Saturday. My wife works Saturday night, Sunday. The next week, it switches up. We work around this whole situation. It seems like a lot of people are upset because they're losing their full-time babysitter. That might not be the case, but it just seems that way to me. As far as going back to school, not going back to school, it's a lot of confusion. I mean, my suggestion would just be to call it a year and start fresh next year. My mother works at one of the local schools in the cafeteria. And as far as you saying, you know, these elementary kids ain't passing COVID, they are. Her and my dad been on lockdown since this all started. Somehow she brought COVID home when Jens decided to send everybody back to school. And Jens did nothing, you know, about it until one of the substitute cafeteria workers decided she was going to go to the Department of Health, and then Jens decided, hey, we better do something. So I think Jens all just need to quit the bickering and act like board members. So that's pretty much all I have to say about the whole situation. I appreciate your phone call.
Thank you.
Hello?
Is this Crystal Oaks?
Yes.
This is Dr. Priatel here at the Altoona Area School District School Board meeting. Are you aware of the motion on the floor?
I am.
Okay, it's public comment. You have 5 minutes.
I know it's getting late, and I don't want to take up any more time than what has already been taken and reiterate the same thing that's been spoken time and time again, that our students need to be in school. Although I do think that you need to amend your motion and do send all the kids back to school in a virtual model. I don't see how staggering them is going to affect the outcome. I mean, like you said, the junior high and the senior high kids are in sports. What about their activities? Like, there's many kids that don't play sports that don't have the opportunity to have those extracurricular activities, you know, strings, continuing on with their instruments, continuing on with drama, continuing on with chorus. Like, you can't get the same experience through these clubs as you can being in person. And second of all, my only other concern is the communication. There's an extreme lack of communication from the district to the community, to the parents. For example, my daughter was in a class that was quarantined 2 weeks. It took 2 weeks for the school district to contact me to let me know that her test, that test was negative, that whoever she could have possibly been exposed to was negative. She could have been in class, but instead you guys kept her home for 2 weeks, which was unnecessary. It's absolutely absurd. And that's my only concern in regards to sending them back, you possibly having a possible exposure and it being negative, and you continue to keep these kids home regardless. Again, my stress is communication between the district and the parents and the community. That's all I have to say.
Thank you.
Hello?
Mary Wilson?
Yes?
This is Dr. Priatel here at the Altoona Area School District Special Board meeting. Are you aware of the motion?
I am.
Okay, it's public comment. You have 5 minutes.
All right. Hello, my name is Mary Wilson. I would just like to add that I'm a second semester sophomore and I'm attending Penn State Altoona. I'm majoring in education. And I would just like to add that at Penn State, we've tried the hybrid method of some people being in class and some people being at home. And I can just add that the hybrid method was much harder than virtual as a whole. And if college students can't successfully perform with hybrid, I truly don't think that elementary and second age students could successfully perform either. So because of that, I believe that the students need to either be full-time in person or full-time virtual.
And of course, if some families don't feel safe with sending their students back, I completely understand that, but we need to have designated teachers that will just primarily be virtually teaching those students. And that's really all I have to add.
Thank you.
Thanks.
Hello, this is Shauna.
Hi, Shauna. This is Dr. Priatel here at the Altoona Area School District Special Board Meeting. Are you aware of the motion?
Yes, I am.
Okay, it's public comment. You have 5 minutes.
Thank you. So I just wanted to say that I am in support of having us start somewhere with getting the kids back to school. I do have a first grader who needs to go back, and I think it's about time that they do start, because in all reality, when there's never going to be a good time to start back. So I am all for that, and I know the older students want to get back too, but they need to realize that these smaller children can't read and write, and part of that problem is they're not in school getting the face-to-face time that they need. So I just want to say thank you for everybody's hard work, and that I support us starting somewhere. I think it's a good start, and you never know what's going to happen in the future, and you can't live in fear. And I know this. I'm a registered nurse. I deal with this every day. I see patients every day. So what makes teachers any different from me providing care to people? If I stop doing that, then nobody will get help. So that's all I have to say, and I thank you for your time.
Thank you.
Thank
Hello? Hello, is this Joyce Remain? Or Remind?
It is. Remind.
Remind, sorry. This is Dr. Priatel here at the Altoona Area School District's Special School Board Meeting. Are you aware of the motion?
Yes, I am.
Okay, it's public comment. You have 5 minutes.
Okay. First of all, I don't have children in school anymore, but I do have 2 grandchildren in school. And since they went on this virtual learning, just from talking to my son and that, the kids are really suffering. Their grades are going down. I mean, it's pretty heartbreaking when you have 2 elementary kids that tell you that they're failing, which, I mean, I'm not sure how bad they're failing, but, you know, that's just pretty heartbreaking. It's hard for them to focus when they are at home and trying to do their schoolwork. You know, school is one place, home is another place. But the problem, I think, with them being at home is a lot of this virtual learning, especially with the elementary kids, because a lot of them are not understanding what they are supposed to do. The other thing I would like to comment on is that I don't know what the answer is as far as whether the kids, you know, if it's safer for the kids to go back to school or not. But I think that the parents should have a say on whether they want their kids to go back to school or not. That way there, like someone had commented earlier, it would cut down on the classroom size. They need to be with their friends, even though they need to social distance and all that stuff. But the problem is I think with them being at home 5 days a week doing virtual learning is stressing, especially the elementary kids, out too much. Now, the only other comment that confuses me is you guys are talking tonight about this hybrid. Okay, you're saying Group A would go to school on Monday, Wednesday, and every other Friday. Group B would go to school on Tuesday, Thursday, and every other Friday. My question is, well, not really a question, it's just I don't understand it. Why, I don't know how often the school is cleaned. I mean, I'm sure, I know there's maintenance, or not maintenance, custodians and that in there every day. But my thing is to be able to maybe better understand, I don't know how I want to word this, to better understand maybe where a possible exposure came from. Why would you not send Group A on Monday and Tuesday, then thoroughly clean the school, which I think you guys had talked about this at the beginning, thoroughly clean the school on Wednesday. They all do virtual on Wednesday, and then send Group B on Thursday and Friday. I mean, here you're sending, you know, right now tonight you're discussing sending A on Monday, B on Tuesday, A on Wednesday, B on Thursday, and every other Friday then between the two of them. I just think that would make it a little bit harder if there is an exposure as far as trying to figure out whether it came from Group A or Group B. So like I said, from the beginning, I had heard that it was to be Group A was going to be Monday and Tuesday, Group B was going to be Thursday and Friday, and nobody went to school on Wednesday because they would sanitize the school really good. I don't know what the answer is as far as these kids, but I think that they do need to be in school, whether it's hybrid or not, just to be able to socialize with some of their friends and just, but I do think that the parents should have a say. I agree with that 100% on whether they want to send their children back to school or not. And I think that's pretty much all I wanted to go over. But the hybrid thing is what bothered me the most. I just didn't understand why you would go A, B, back and forth, skipping a day. You know, send Group A on Monday and Tuesday, thoroughly clean the school on Wednesday, send Group B on Thursday and Friday, you know, and then the rest of the time they do the virtual. There is one other thing I did want to say is, both of my grandkids are in elementary school, and my son and his wife just are like going crazy with the amount of work that the kids have to do. And I mean, you know, like I said, it's harder for them to focus when they're at home than if they're in front of a teacher, but nobody honestly knows what is the safest thing to do.
Thank you. That's time.
Thank you. Bye-bye.
Hello, this is Sandy.
Sandy, Mrs. Ortiz, this is Dr. Prietel here at the Altoona Area School District Special Board Meeting. Are you aware of the motion?
Yes, I am.
Okay,
Yeah.
It's public comment. You have 5 minutes.
Thank you. I just wanted to call in to say my daughter is a fifth grader with special needs on a plan, and she's been on virtual since day one, and how well she is excelling. And I wanted to make sure that positive was being relayed. The kids that I hear from listening to a lot of the classes that are failing are ones that aren't turning in their work, and that they get. I do hear that the kids that are going back and forth, their virtual is different than what the kids that are on full-time virtual, but they get at least an hour a day where they can have one-to-one with the teacher. Now that she's been having a little more struggles, she gets extra help 3 times a week, one-on-one with a teacher, and just how well she's actually really doing. And I have no intentions of sending my child back until this virus is over. I've seen pictures on Facebook when the kids were in school and how they weren't social distancing. And how can you expect young children to stay 6 feet apart? That's just not the way it is. But I really just wanted to say how well the virtual is working. She is high 90s. Last working period was straight hundreds. I do work, so this is a struggle. This is not the way I want to spend my days, but this is what we need to keep her healthy. The next strain of the virus is just starting, and we don't know how it's going to spread and how much it's going to be. And we're just trying to make our home positive and not make this be a negative for her. Yes, does she want to be with her friends, but she also knows that she doesn't want to get ill. So we try and make our day pleasant for her and spend the time interacting. You know, do I want to go to work, come home, do schoolwork? My hours with this COVID, my hours switch. And so sometimes I'm home during the day, sometimes I'm not. But we're making it work. And the teachers are doing an excellent job. And she gets the virtual classes 5 days a week. And they sit and they interact. But I do have to say that from what we hear, that the kids, you know, the teachers are always complaining, just turn in your work, just turn in your work. And that's not a hard thing to do. And I just wanted to praise the teachers for what they're doing. The teachers that my daughter has, even though she's 5th grade, the teachers were all from the high school, and how they have adapted to bring the work level down to a 5th grade level. And they're struggling hard. And they're just doing very, very well, and they need to be praised. And I really think that the kids need to stay home as much as they can, you know, so that we don't spread this more. This new virus that's coming out, it could be really bad. And I just want to say thank you for your time. And I hope they make the decision to keep all the kids home so that they can go back full time and be with their friends.
Thank you.
Thank you.
Thank you.
Good evening.
Heidi Mullendor.
Yes,
This is Dr. Priatel here at the Altoona Area School District School Board meeting. Are you aware of the motion on the floor?
I am. Thank you. I would like to say, first of all, a huge thank you to the teachers and the staff and the board. I've listened to the board and teachers taking a lot of abuse. I would like people to know that, you know, the board, the teachers, the staff, they are not the enemy. Many of these people are professionally trained educators. They are not the enemy, and they have to follow state guidelines. Unfortunately, we are at the mercy of a pandemic. And we have, you know, two major concerns with these issues: health and safety, and good education and mental health. So we're battling for two different things that are at odds. I personally am an educator. I also have an 11th grader in the school district. My 11th grader does not want to go back. Her experience with the hybrid model was not very effective. She said it was very frustrating. She does not like being home virtually, but it's better than the inconsistency of the hybrid model. She also knows from her experience in her virtual classes, talking to classmates, that there are many of the classmates that do not mask at home. Several of them had COVID. She does not want to go back into the classroom with kids who have not been masking. She does not feel safe. Dr. Malloy at the last board meeting said that our staff is our most precious resource. I agree with that. The staff, the teachers, the maintenance, the cafeteria folks, clerical, everyone, if we don't have those people healthy and fully operational, the kids will not be able to stay in school for very long. Right now, teachers are working without a contract, and this is the third time they're being asked to work without an increase in pay. And this is a hell of a year, pardon me, to ask them to do that. My opinion is, for this motion, back up your staff and your students by allowing the teachers to get their first vaccination, and then bringing the kids back 2 weeks after the teachers get their first vaccination. As Dr. Malloy said, we need to do this right and be safe. Everyone's concern is that the kids need consistency and good education. We cannot have good education until we're back, and we cannot be back consistently until the staff is safe. Thank you for your listening.
Thank you.
Hello?
Dan Cobbler.
Yes.
This is Dr. Priatel here at the Altoona Area School District Special School Board meeting. Are you aware of the motion on the floor?
I am.
Okay, you have 5 minutes.
Thank you. I was just wanting to comment on that. I think by the kids going back to a hybrid model is setting them up for failure, because you're going to have, with this other strain coming out, if a teacher was to contract it and, they have to quarantine classrooms and things like that, well, then that pushes the kids out of the school. And I completely agree with some of the parents that, they need consistency. But you know what? The fact of the matter is we don't have, and neither does the school district have a manual on how to handle something like this. We're just flying at the seat of our pants. And, my oldest, he has a debilitating illness. He's a type 1 diabetic, and having to deal with all of that and him constantly being on top of his schoolwork from being completely virtual has been a success, I am thinking. But, there's no right or wrong way except for this hybrid model, I don't think is the right way. Because just as you start to get the kids back into a pattern, then guess what? We have to pull everybody out because there was a positive case. So then we're back at square one. So that's my feeling on it.
Okay, thank you.
Thank you. Bye.
So ends public comment.
So now we need to move on to the vote. If I could ask Elizabeth to read the motion one more time.
Yes, it's a motion to return elementary students to school in a hybrid mode as of February 8th, 2021, to be followed by a return of the secondary students on February 16th in hybrid mode, with all teachers returning on site February 8th, with all special populations returning to a full 5-day week as of February 8th, and with a full traditional 5-day return for all students occurring after we've had 2 consecutive weeks in a low transmission level rate.
Thank you.
Just to clarify, the special populations is pre-K to 12.
Okay, and right, with special populations understood
Correct.
being pre-K to
Your
12.
self-contained population.
Self-contained special
Correct.
population.
Okay. Special populations as discussed this evening. And and then we just need someone to move that.
Thank you. Can we have a roll call vote, please?
Oh, I think you need a motion in a second.
We have.
We have a motion,
that one,
Mr.
yeah,
Mr. Baker and Mr. Francis.
Okay, right.
Mr. Baker,
Yes.
Mrs. Bream,
Yes.
Mr. Francis, Mr. Hoff,
Yes.
Mr. Hoover,
No.
Mrs. Irwin Adams,
Yes.
Mr. Johnston, Mr. Cruz,
Yes.
Dr. Malloy.
Yes.
Passes 7-2.
Thank you.
I just want to say, I listened to the teachers yesterday, and the teachers want the vaccine. Wait 2 weeks and then come back. That was my decision.
Ron, well, I also think it's important. We ended last week's meeting with Kelly making a new proposal. So I guess I'm going to do that too. I'm going to ask that we have another meeting next week to rediscuss our reopening plan, because we don't know where the numbers are going to be a week from now. So Kelly was granted a special meeting for next Tuesday. So I am requesting a special meeting for next Tuesday so we can reevaluate our situation when we get the new numbers and we see what happened in other school districts.
Don't we have a meeting next Monday?
We're meeting on Monday. We can do that then.
We can do it at our meeting on Monday.
Is it a regular meeting?
Oh, yeah, if you have a motion, we need someone to second that.
Committee of the whole Monday, Rick.
I hear you.
So the only problem we'll have, Rick, is we won't have students until February 8th. So we probably won't have any information on how well the plan is working. So we'll need one after kids are in, I think, to see how it goes.
Well, I once again, I was just putting out there because Kelly threw a curveball in last time and we gave her a meeting. I'm asking for the same regard, and apparently we're not going to do it.
Well, second.
Well, Ron, would you second that?
He was asking you to second it. He's declining.
I would be more interested in discussing after the kids are in to see the data and the numbers, what effect the program is having.
I hear you. One more point that definitely needs to be stressed tonight. Several of the callers were misinformed. We are the school board. The people you see on the screen and here on the computer are the school board. We are the ones making these decisions. It is not the teachers. They are not refusing to do anything. As a matter of fact, many of them want to come back. We, the board, make that decision. It's not the teachers deciding they are not going to do their jobs, like several people have said during this. Our teachers are willing to educate in whatever format we guide them, and the administration implements that. I'm just getting that on the record.
Okay, thank you. Meeting adjourned.